Health and welfare. As everybody comes in, we'll talk about kind of the rules of engagement. If there's a bill that you want to testify for, fill out a green card and give us your opinion. And if you want to testify, you have the opportunity to testify. If you're in opposition to a bill and you want to fill out a red card of opposition, we can get that done also. If you're here just for informational purposes, you fill a white card out. So today is May 24th. Let's kind of get everybody together. Come on, y'all, everybody. Let's sit down and be quiet. Come on. All right, we're going to have a good hearing and we're going to behave. Madam Secretary, please call the roll.
Yes, sir. Okay. Senator Mills.
Present.
Senator Mills present. Senator Barrow. Here. Senator Barrow present. Senator Boudreaux. Present. Senator Boudreaux present. Senator Carter. Present. Senator Carter present. Senator Hinchins. Here. Senator Hinchins present. Senator Lunow. Here. Senator Lunow present. Senator McMath. Senator Mizell. Here. Senator Mizell present. Senator Pope. Senator Pope present. 8 present.
Thank you very much. Ladies and gentlemen in the audience, this is what we'll do in committee members. We'll hear House Bill 457 by Representative Cruz first. And then I think there's a lot of folks that would like to hear House Bill 648, and you've probably traveled from near and far, so we'll be hearing that one next. It's HB 648. What we'll do, committee members, because we have a lengthy agenda and some of the bills are becoming very complex to debate, we'll go on 648 with a 3-minute rule. So if anybody is here to testify on 648, everybody will get an opportunity that wants to testify, but we'll limit the testimony to 3 minutes to be fair to both sides. Representative Furman did say that he's brought in one expert witness that he'd like to have them have a little more time, so we'll give that leeway to that. So we're going to try and give everybody a very fair hearing, but that'll be the rules of engagement. Is the committee members okay with that?
Yes, sir.
Okay, so we'll go to 3 minutes. So Representative Cruz, you first at 457, and welcome to committee.
Thank you, Mr. Chairman. Thank you, members. I appreciate you spending your time to hear this bill. I'm not going to pretend to understand what a woman must go through in a miscarriage, but there are ministries out there that do, and they are tending to the needs of those women. And one of those are a lot of women want to be able to recognize that child that they've lost prior to 20 weeks, often. So this bill is a bill to get a commemorative certificate honoring that life. It does provide the leeway for the physician to decide is if something to be presented immediately or later, or how to present, because it's a very traumatic circumstance. I've heard from several women on this issue, and some would like that information, right away, and some said, no, let me wait till I get home or something like that. So it does allow that leeway. This is something that won't cost the state any money. It's going to be something that is just provided and has no legal effect. It's just really a remembrance of that child. So I'd sure appreciate your recognition of
Good
this.
legislation. And I tell you what, you have only cards of support. We have, let's see, on the board first is Senator Luno.
Thank you, Mr. Chairman. I move favorable.
We have a motion to move favorable. We do have two members of the audience that would like to testify if they'd like to. Now would be the time. Christy Hike and Chris Alexander, we do have a motion to report favorable. If you feel that you want to testify, fine, but I see no opposition whatsoever, so it's your call.
I don't think they're in here.
Okay, well, then we have a motion by Senator Luno to report 457 favorable. Is there any opposition to the motion? Seeing no opposition, 457 will be reported favorable. Thank you for your work, and it's been a pleasure to serve.
Appreciate that. Likewise. Thank you.
Thank you. And we'll record all of the cards of support into the minutes. So, ladies and gentlemen, we'll be hearing House Bill 648 by Representative Furman. And Representative, it's all yours, and tell us what your bill does and why do we need it. So y'all, if y'all see me looking at my clock, my phone a lot, I'm just the timekeeper. So
Yeah.
I'm paying attention.
Thank you, Mr. Chairman.
Okay.
Senators, this bill simply protects kids from harm by ending the use of unproven, experimental, and irreversible chemical and surgical procedures on children in Louisiana suffering from a condition called gender dysphoria. In recent years, the United States has seen an exponential increase in the number of children who experience extreme discomfort with their biological sex. These children deserve to be treated with dignity and respect and are best served by compassionate and effective mental health care and counseling. As we discuss this legislation, I ask that you set aside any preconceived notions that you may have about this issue and focus strictly on the available science and research. Perhaps the most compelling evidence to consider today is the fact that several progressive European nations who pioneered chemical and surgical sex change procedures, like England, Sweden, and Finland, have completely reversed course on this issue, and they are now recommending counseling and watchful waiting as opposed to the use of dangerous and experimental drugs and invasive and irreversible surgeries. The well-respected liberal British magazine, The Economist, last month published 2 articles expressing complete dismay at the fact that in America, we have allowed politics to cloud our judgment and interfere with our ability to discuss this issue rationally and make decisions based on systematic research and medical science. The Economist said this: medical science is not supposed to work this way. Treatments are supposed to be backed by a growing body of well-researched evidence that weighs the risk and benefits of intervention. The responsibility is all the heavier when treatments are irreversible and the decisions about whether to go ahead are being made by vulnerable adolescents and their anxious parents. Please consider the following facts as we examine this issue. We know that in over 85% of kids experiencing gender dysphoria, the confusion will naturally desist with time and counseling. We also know that despite claims to the contrary, rates of suicide are not decreased and mental health outcomes are not improved by so-called gender-affirming care, which allows distressed children to self-diagnose and supposedly consent to decisions that will lead to permanent damage, including sterilization and loss of sexual function. We know that children do not have the maturity or the mental capacity to fully understand the consequences of these experimental procedures. Senators, when you hear testimony from those in the healthcare field opposed to this bill, I want you to consider how lucrative these experimental procedures are for the gender industry. A single subcutaneous implant of a puberty-blocking agent can cost up to $50,000. We know that starting kids on puberty blockers practically always leads to injecting children with extraordinary doses of wrong sex hormones, then to mutilating surgeries, and then to being lifelong customers of the gender industry and Big Pharma. We know that Planned Parenthood and the gender industry has identified these experimental procedures as a cash cow to replace the lost revenue from abortions now that Roe has been overturned. During the House floor debate of this bill, the local Planned Parenthood branch tweeted out that defeating this legislation would create jobs and generate income. This tweet has since been deleted, but they are correct. Every single state around us has already passed similar legislation to protect their children. If we don't pass this bill, Louisiana will become the destination in the South for these harmful procedures. Performing experimental medical procedures on children is not the kind of economic development this state needs. Senators, this bill passed the House committee and the House floor with overwhelming bipartisan support. This bill is not about hate or fear or sexual orientation. It's not about race or particular religion or party affiliation. This bill is about protecting innocent children. No one in Louisiana has the right to harm a child. Please support this legislation and join me today in saying stop harming our kids.
Next week. Thank you very much. Yes, sir.
And-
Please state
Yeah,
your-
Mr. Chairman, I'd like to start with Mr. Sharp, if that's okay.
whatever you'd like.
Thank you. Good morning, Mr. Chair, members of the committee. My name is Matt Sharp. I'm Senior Counsel with Alliance Defending Freedom. And I want to emphasize 2 points about the narrow focus of this bill. First, this bill protects children, children who deserve to experience a natural childhood. who we know are highly susceptible to peer pressure, social media, and other negative influences, who lack the capacity to fully weigh the risk of a course of action, and who this legislature has long protected from things that we know are harmful to children, things like smoking and alcohol and other things. Once an individual reaches adulthood, they are no longer covered by this bill. Second, this bill regulates 3 and only 3 things: puberty blockers, wrong sex hormones, and surgical procedures, and only when these 3 things are done for the purpose of gender transition of a child. States like Louisiana have long regulated certain drugs and medical procedures. For instance, Louisiana already heavily regulates hormones, specifically the use of testosterone, an anabolic steroid, prohibiting it for bodybuilding, muscle enhancement, or increasing muscle bulk or strength because, quote, use by a person who is in good health is not a valid medical purpose. So Louisiana is already regulating some of these substances. Puberty blocking drugs used for any other purpose, whether it's precocious puberty or cancer treatment, are not covered by this bill. Hormones for any other purposes, including a natural hormone deficiency, are not covered by this bill. And even surgeries, such as a mastectomy to treat breast cancer or reconstructive surgery for someone in a car accident, are not covered by this bill. Likewise, any medication other than puberty-blocking drugs or wrong sex hormones given to treat the symptoms of gender dysphoria or given to treat any other physical or mental health issue are permitted by this bill. And that includes helping kids with antidepressants or medications to help a child with autism, help a child dealing with a personality disorder or some of the other comorbidities we often see. Importantly, all counseling and therapy are fully permitted by this bill. Indeed, that's exactly what we want to prioritize, is making sure kids are getting counseling and psychotherapy to help address some of these issues. HB 648 is clear and precise in what it regulates: puberty-blocking drugs, wrong sex hormones, and sterilizing surgeries. No studies have shown that these drugs or procedures are safe and effective for children, and rather, as Dr. Van Meter will discuss, a growing body of evidence and a growing number of countries are concluding that these 3 specific items, the 3 things regulated by 648, pose dire health risk to minors. Thank you, Mr. Chair.
Thank you for your testimony. Thanks for coming in. Yes, sir.
I'm Quentin Van Meter, a pediatric endocrinologist in private practice in Atlanta, Georgia. I've been in the field of pediatric endocrinology for 45 years. I trained at Johns Hopkins, where Dr. John Money was on the clinical faculty. He was one of the 3 folks who brought on the so-called sexual revolution, along with Alfred Kinsey and Harry Benjamin. Dr. Money did experimentation on infants and children and on adults, which ended up with disastrous results, and his program was closed down at Johns Hopkins by the incoming chairman, Dr. Paul McHugh, and the psychiatry department. We've been there, we've done that, we've read the book, we know what the end of the story is. This lay buried in the annals of embarrassment at Johns Hopkins for nearly 40 years until it reared its ugly head again in the 2007 timeframe, when the first gender clinic opened up in Boston in the United States. I've got 2 documents in front of me. One is called Study of Gender Reassignment Procedures on Minors, which is a document from the Louisiana Department of Health. And I have an article in the Journal of Sexual and Marital Therapy published earlier this year on the basis of the Dutch Protocol. Let's go back historically and see what happened. Dr. Money believed that you could bend the gender of a child and create a new individual with a different sexuality by just looking at social factors and creating an environment which changed, supposedly, a biologic male into a biologic female and vice versa. That was a failure. It didn't work. It ended up with suicides and great morbidity and mental health as a result. That was the foundation of the Harry Benjamin Society, which was named after Dr. Benjamin, and that became the World Professional Association of Transgender Health. This is the foundation on which this procedure of medical transition and surgical transition rests. And it started with children in what was called the Dutch Protocol in the Netherlands in 2000. The paper here that I have in my left hand actually takes that Dutch protocol, which is the entire basis and that states what is beneficial for medical and surgical transition of gender-confused children, and it tears it apart. It shows how this study took 196 patients and pared them down to a final 50 patients, And those patients were carefully chosen specifically to show the outcomes they wished to show, that there was an improvement in mental health by doing medical and surgical transitions in these children. This paper shows how it was selective data choice, and it basically takes the foundation of all of the WPATH guidelines and the Endocrine Society guidelines and crumbles them into ruin. It shows how when you don't use science, but you use ideology, it's like you're basically building an airplane while you're flying it. Now let's look at the hormonal aspects. I'm an endocrinologist, I'm not a mental health provider. But the use of puberty blockers, puberty is not a disease. I'm assuming all of you on the panel went through puberty, right? And can I assume that? Okay. So puberty is not a disease. It's a rough time in life. Its purpose is to take an infertile human being and transfer them into a fertile adult. It has a purpose. It has lots of pain and agony that goes with it. You add to that all of the social circumstances of the last 2 decades, the advent of internet and the COVID epidemic, and you put that on the backs of children, and they have a great deal of emotional suffering. When that happens in the midst of puberty, the kids are struggling to find a place to be, a place where they belong. And this transgender industry has allowed them to grab onto that as a shiny object to save their lives and make them happy. The New England Journal just published a study of 2 years of data in the United States from 4 centers, just 2 years of data. And in that 2 years, in that study population of transgender kids who were treated, 2 children committed suicide. That would normally end a clinical study in its tracks. The safety committee would say, I'm sorry, we cannot continue to do this study. But unlike the rest of us that do clinical research, this study goes on, and it was touted as a success for the mental health of these kids. Judging the mental health improvements at 1 year, 2 years, 3 years, and 5 years is not adequate. You have to look all the way out to 20 years, and that's what happened in England and Norway and Sweden, and that's why they shut the programs down. There is no benefit to mental health in taking transgender children and affirming them medically or surgically. The completed suicide rate in the Tavistock Clinic of children who were treated and affirmed is 0.03%. The suicide rate of those waiting to get into that transgender program were unable to because of long waiting periods of 3 and 4 years. That suicide rate of the untreated gender dysphoric children is 0.03%. That's hard data, that's science that cannot be refuted. To say that these children are going to commit suicide if we do not go ahead and affirm them is a bald-faced lie. It's a bludgeon for parents to make them feel guilty. It is not appropriate. We do not practice medicine. We do not harm children. So I would just leave it with that the science is not there. The pharmacology of what the cross-sex hormones do is well known, because we have disease states in adults where we go head over heels trying to stop the overproduction of these hormones that don't belong in the biologic body in order to save the lives of those individuals. Why on earth would we purposely go ahead and give these kids hormones that will create disease that we know happens? It's happened in adults. We do not have any data on fertility long-term of puberty blockers. We do not have data on the long-term cross-sex hormones. It's an open-ended experiment. We are flying an airplane while we are building the airplane when we do this. It's not appropriate that we do that. And it's also a great disservice to the gay and lesbian community for adults who might have enjoyed a sex life if they had not had their genitalia mutilated and their sex organs ruined by medical and surgical interventions. So I think in order to support the community at large, it's appropriate to step in when harm is being done and narrowly carve out this kind of intervention and make it not happen in the state of Louisiana. Thank you very much.
Thank you all very much. We were just kind of adding up all the people that want to speak, and if the folks in opposition and the folks in support want to speak at a 3-minute rule, it'll be over 2 hours of testimony, which we find. That's our job. So we'll call in anybody that wants to speak on the for the proponents of the bill that have filled out a green card. And the only thing as a committee we would ask is that you talk about the bill. We want to debate the bill. And I know everybody has a personal story to tell, and we appreciate that, and we want to hear it. But in your 3 minutes, it helps this committee to get information in concerning the bill. Very insightful information. We thank you three.
Mr. Chairman,
Yes, sir, please.
I know we submitted our cards of support in a particular order, and I'm speculating they may have gotten mixed up.
Yeah, we got it just keeps coming in.
Could my next six witnesses or so, could we do them in a particular order?
You're the author. You
Okay.
take them in any order you want. I'll try and just make sure everybody gets a chance.
Thank you.
You take them in any order. As the author, you say what you want. And now we will start the 3-minute rule. So if anybody, I want to be very respectful, but if it goes over 3 minutes, I'll stop the testimony for the next person. Can you keep the timing? Yes, good morning.
Thank you, Chair Mills.
Just state your name, and we look forward to hearing your testimony.
Thank you, Chair Mills and committee members. My name is Billy Burley. I'm a native Louisianian living in Twin Falls, Idaho. I am a detransitioner. As a child, I had reoccurring thoughts that God made a mistake. I'm a girl. I prayed every night before going to bed, and I asked God, please make me a girl before I wake up. If I could have, I would have leapt at any opportunity to have transformed myself to a girl at that age. In my early 20s, I sought help for the disconnect between my mind telling me I was a woman and my body telling me I was a man. And seeking help and doing my own research, the message I received was that I had to change my body to match my mind. After seeking any other path forward, I decided to take the therapist's encouragement and the advice I read in journal articles and books to change my body. In my late 20s, I started on testosterone blocker and estrogen. My emotions were up and down, but I was supposedly on this new road to my happiness, and that made me happy. In my first surgery, I had a penile inversion, an Adam's apple shave, and a brow shave. After the surgery, the surgeon and nurses had difficulty stopping the bleeding from my new man-made artificial female genitalia. My artificial female genitalia was packed with gauze and a sandbag was placed on my lower abdomen, but the bleeding did not stop. I received a blood transfusion and plasma, and eventually the bleeding stopped. But this change required 2 surgeries, so about 4 months later I was back for part 2, and that was labiaplasty. I was desperate for the happiness I believed was ensured to me. After this, I had more body and voice feminization surgeries, but after 7 years of trying, I had more problems at that point than before I started the road of transitioning. In my early 40s, I detransitioned. I changed my legal identification back to male. I went through another surgery. To have female-to-male surgery, the surgeon required approval letters from 2 therapists. These therapists I saw said that I was not transgender and never should have been diagnosed nor affirmed as transgender. They said I was male. In summary, I received gender-affirming health care in my 20s. The therapist affirmed my thought that I was a woman trapped in a man's body. As a result, I spent well over $100,000 on my transition to presenting as female. I'm surgically modified. I have a scarred body. I have to take weekly testosterone injections. The bottom line is that receiving gender-affirming
Thank you.
health
The 3
care...
minutes up. Appreciate it.
Thank you.
Oh, 30 seconds. I'm sorry. You got,
Oh.
this is our first dress rehearsal. You're going to have 45 seconds. You got more
Oh,
time.
thank you, sir.
Sorry, I didn't mean to.
No
This is our
worries.
first time to rehearse.
Very good.
You keep going. You keep going.
Yes, sir. As a result, I spent over $100,000 on my transition presenting as female. I'm surgically modified, I have a scarred body, and I must take weekly testosterone injections. The bottom line is that in receiving gender-affirming health care and transitioning, this did not resolve my childhood hurts and pains that I struggled with. I truly wish I would have received mental health care instead of the gender-affirming health care that I did receive. This did great harm to me. Thank you, sir.
Thank you for your time, and thank you for coming to Baton Rouge to testify. We appreciate that. And you hit it right at the clock. This is an example, y'all. You did good. Whoever wants to be next, y'all.
Good morning, ladies and gentlemen. My name is Ted Hawley, and I appreciate the opportunity. I'm very humbled to be here. I want to first say, a little bit unusual, being transgender is very difficult. None of us woke up one morning and said, I want to be transgender. Just like you don't wake up and say, I want to be an alcoholic or a drug abuser. And it's a hard road for those that either support or are against. It's a hard road. It takes courage and determination to do what you do. But back in my day, I transitioned in 2010. Yeah, I was transgender before it was cool. Not really, but a little humor there. But yes, I started from 8 to age 50 before, it was, couldn't even talk about it. But yes, at age 50, I had to wait till my adult children got out of the house. I like Billy. I've done all the surgeries, 2 on my face, breast augmentation in and out, GRS, hundreds of hours of electrolysis. So why am I telling you this? I have the degree. I have a PhD in being transgender. And, at first it was really cool. I was happy. It's like a car with a big payment. You're happy with it. Then after a while, things start breaking and going south. Well, that's what happened to me. I started having waves of suicide, and my incongruity got so great that, I had to go back to being who I originally am. So that's just a brief thing. But the thing, getting onto the bill, is one, that if we do this to children, it's not reversible. I will never, ever have my male organ back. Never, it's gone. And how in the world do we do that to a child? A child who one day wants to be a fireman, the next day a spaceman, next day wants to be a clothes designer or a cook or whoever. I mean, it just makes no common sense to do this to children who are innocent. We are, as we talked earlier, they cannot have a normal sex life. Most of them will never have an orgasm. Like, if you do it, you're not going to be able to be a father. You're going to tell this young man or this young woman they can't be a father or a mother? That just makes no sense. So I just ask that we treat this really real issue, not with cutting stuff off. Do we cut anything off for any other thing like an infection? No, we don't do that. We deal with the issue. We deal with the heart. And cutting stuff off just increases suicide. In Sweden, it's proven it goes up 20%. So please make the right decision. Protect our children.
You were right on time. Thank you. And y'all are a model group. And thank you. You came in from Alabama. Thank you. Thank you. Yes, ma'am.
Good morning. Thank you for the opportunity to be here. My name is Tandy Lynn Hebert, and I'm a mom from Lafourche Parish. So, a few years ago, my daughter was told by professionals at Children's Hospital in New Orleans that she was really a boy in the wrong body. And then her father and I were told that we had to accept our daughter as our son. Last year, I took her to an endocrinologist at Children's Hospital. Their policy was to separate children from parents at 13 years old, separate them from private exam rooms, separate them from emails, separate them from medical records. They sent my daughter for a hand x-ray to see her stage of puberty, and because they was going to give her puberty blockers on that first visit. I said, no way, but that was not until after a doctor named Ryan H. Pasternak walked in the room, and he tells my daughter, hey, I haven't seen you since Calhoun. Calhoun is the name of the inpatient psychiatric unit for adolescents that he's also in charge of. I don't believe this is right. Like, he never tried to address any of my daughter's underlying issues. It was, he gave her a pamphlet about testosterone and such. I would like to read a piece of that, if that's okay. Don't be afraid to explore and experiment with your new sexuality through masturbation and with sex toys. There was much more that I didn't feel was appropriate in that handout that he gave her in the packet. Like I said, I don't believe this is right, and I want to be able to bring my daughter to get the help that she needs, but I can't trust medical professionals right now. So if you guys can pass this bill, that would be greatly appreciated, because then I can, bring her for the help she needs. Because, first, doctor, do no harm. Like, we should be able to trust our people caring for us, So thank you, and I'm open for any questions. Thank you for listening.
For your testimony, Ms. Hebert. We
You're
appreciate
welcome.
that.
Thanks, no problem.
Thank y'all. Representative Fremmer, whoever else you, in your 6 you want, it's,
Yeah, our doctors, Louisiana doctors.
okay. Three minutes. Everybody's 3 minutes. So, yo, we going with the 3-minute rule for everybody, so. Welcome.
Good morning.
Yes.
Thank you for having us here, Senator Mills. My name's Dr. Mo Fago, excuse me, and I'm a pediatrician from New Iberia for over 42 years. Senators, you should know that terrible things are being done to adolescent transgender patients in our state. They are receiving gender-affirming care with dangerous hormone drugs, and they're also receiving disfiguring surgery. Importantly, these treatments have been discontinued or discredited in countries all over the world, and in 20 states in the United States, and there's 8 others considering this. And I urge you to consider Louisiana to be the next on the list to discredit all of this. Sadly, the very doctors that we look up to and the institutions that we normally look to for guidance are the same ones promoting these treatments for gender care. These physicians and their hospitals have lost their way. It is now clear that they are no longer practicing good quality health care. Having said that, I want to make 2 more points clear. First, it is that gender dysphoria is best treated by the gold standard of honest, compassionate mental health care. The studies that have been done show that this will allow adolescents in time to then return to who they normally were. As an example, last year in England, following a rigorous scientific review, their national healthcare system recommended mental health care as the primary and only first-line treatment against for gender dysphoria, and they recommended against this gender-affirming care. We are now seeing this happen in countries all over the world and in many states in the United States. Secondly, we need to debunk this claim that increased suicides will result if we do not treat children with gender-affirming care. This is simply not so. 2 studies, one in 2022, the British had 15,000 adolescent transgenders. They followed them for 10 years. There were 2 suicides in each group, one receiving gender-affirming care and the other that did not. And no, gender-affirming care does not decrease suicides. And the other study in 2019 revealed no mental health improvements after gender surgery. And in fact, that particular study showed a slight uptick in suicides in those that had had surgery. Senators, Louisiana needs to stop gender-affirming treatments and instead promote mental health care and stop frightening and manipulating parents and patients with false threats of suicide. Let's pass this bill onto the floor of the Senate where your colleagues might have time to vote for it. Thank you.
Thank you, Doctor. Appreciate your service.
Yes.
Thank you.
Thank you for the opportunity to speak before the committee. I'm Dr. Stephen Felix, a board-certified developmental pediatrician with 35 years of experience in pediatrics. As a developmental pediatrician, I care for children with disabilities of varied kinds, including ADHD and autism. From a developmental perspective, adolescents have not been considered capable of making significant life decisions due to immaturity of decision-making capacities. Recent brain imaging studies confirm that during this period, the brain has not reached adult maturity. Emotional centers of the brain which respond to sensory input and largely drive emotional response are developed in early puberty. However, the prefrontal cortex of the brain is not well developed until early adulthood. The prefrontal cortex coordinates executive functioning. Executive functions allow an individual to pause long enough to take stock of a situation, assess his or her options, and act appropriately. Immature functioning undermines judgment and decision-making. The temporal gap between the development of the emotional system of the brain and the cognitive control system of the brain underlies adolescent risk-taking behavior. This temporal gap has been compared with starting the engine of a car without the benefit of a skilled driver. Among the many behavior changes that result from this disconnect, three most robustly are seen. 1, increased novelty seeking, 2, increased risk taking, and 3, a social affiliation shift toward peer-based interactions. From experience, we all recognize these behaviors in adolescence, behaviors which predispose them to make poor choices, particularly under the influence of peers. Overall, this results in adolescents being risk takers to a far greater degree than adults, and behavior studies indicate that adolescents often undervalue the true consequences of their actions. Noted research on the prefrontal cortex underscores the lack of ability of adolescents to make truly informed decisions about medical care, including medical and surgical interventions and gender reassignment treatments. Of note, executive function abnormalities are even more notable among individuals with autism and ADHD, two populations with 7 times higher reported rates of gender dysphoria. Maturation of judgment is reflected in the high desistance rate in individuals with gender dysphoria in late adolescence. A 2021 Swedish study shows that most young gender dysphoric children, if left alone, revert to the choice of their biologic gender with no medical intervention. The study concluded that watchful waiting is the recommended treatment, and that there is up to a 93% rate of natural resolution of gender-related distress. Recent recommendations from Sweden, the UK, and Finland are to opt for psychosocial support and to discourage medical or surgical interventions, particularly given the high rate of mental illness in individuals with gender dysphoria. Further, recent studies show that gender transitioning leads to increased rates of suicidality. This highlights the reality that adolescents, as they mature, recognize the error of their now irreversible choice.
Thank you, Doc. Appreciate you.
Thank you. Hello, my name is Dr. Evelyn Griffin from Baton Rouge, board-certified OBGYN for over 15 years. Puberty blockers are not FDA approved for gender dysphoria, nor is testosterone or estrogen. Sweden and the UK felt there was also insufficient evidence to support their use, and that's one of the reasons why their Tavistock clinic in England closed last year. That was the biggest pediatric gender clinic in the world. The FDA cautions that estrogen and testosterone increase the risk of stroke, heart attack, blood clots. There are no high-quality studies done for cross-sex hormones, so there is valid concerns for these risks in minors. Regarding puberty blockers, in July of last year, the FDA even added a warning about a risk of pseudotumor cerebri when given between ages of 5 and 12. This is a condition of brain swelling that can actually cause loss of vision, and I have seen this in 2 patients of mine. Often the hormones injected weekly or monthly have to be taken for life, so the risks I just described multiply over time. These treatments are also expensive, on average $100 a month for hormones. Puberty blockers can be $1,200 a month for injection or tens of thousands of dollars for implants. So we're talking about a lifetime treatment that is a very lucrative industry. So if a patient is not able to afford this, they will go into withdrawal. Next, there is no conclusive evidence to show that in healthy children, puberty blockers are reversible. That means potential infertility and sterility. A puberty blocker, along with testosterone, for example, in a girl, can lead to enlarged clitoris and an Adam's apple, and that cartilage is permanent. Regarding surgery, if a minor cannot get a tattoo, then why sign them up for permanent disfiguring surgery? If breasts are removed, there is no chance in the future for breastfeeding. If testes or ovaries are removed, then absolute complete infertility and sterility. And there is no surgery that can make sexual organs fully functional or have full sensation. I invite any questions regarding surgical complications, but I will at least say that the most common is infection of skin incision, which according to a Johns Hopkins study, the risk is up to 3%, and that is higher in the genital region. We accept that risk for surgery that is necessary, but that is a significant risk for a healthy young person. This bill is about first do no harm. The rate of mental health problems in gender dysphoria is high, up to 58% per the Journal of Transgender Health, and the rate of autism is 6 times higher. And there are signals of social contagion also with suggestible kids. So what these kids need first is time to address their social situation, their family dynamic, their mental health, before taking the risks of cross-sex hormones or surgery. Thank you.
Thank you very much, Dr. Griffin. Appreciate you. Thank you. Okay, now it's open to the general public. Oh, we do have a question? I'm so sorry. Senator Mizell?
Yeah. Thank you, Mr. Chairman. I'll be very brief. I just want to say I believe it speaks to the gravity of what this bill is doing for you to come from your practice, make the trip, and share this information. I appreciate your engagement on the conversation we're having today as physicians. I think it's really important. That's all.
And I guess, no question, but I guess just to understand more, it looks like some of the testimony you're giving, when I look at the American Academy of Pediatrics, Louisiana Psychological Association, it looks like the medical community is not in lockstep. I'm not saying one side's right or one side's wrong, but it does get kind of contradictory when people with the pedigree you all have are sending in statements that are kind of polar opposite of one another. So that's where we as a committee have to hear this. But I will tell you that sitting on our desk is evidence that some of this does make merit. But I did want to just put that in the record for you guys.
Could I address that quickly?
Oh, please, because it's people with credentials that are all respected within your medical community.
There's different types of studies. There's case reports, there's prospective studies, there's randomized controlled studies. The problem with the studies that the AAP reports and others are they do not have significant randomized controlled trials. They have small sample sizes. They have poor follow-up. They have a lot of people lost to follow-up. They have individuals who they have a very short time that they follow them. That's why those are the studies. When I teach residents, I tell them there's different levels of evidence, and the levels of evidence that the AAP and other organizations are using are very low, which would be considered either class 4 or class 3 level of evidence, mild to moderate at best. The current studies that are coming out of Sweden, the UK, Finland, are long-term studies where they've looked extensively and they've said, wait, this is all wrong. The quality of evidence that supports this transition therapy is poor. The level of evidence that we're presenting is strong.
Sure. Just wanted to put on the record that there's a lot of organizations on both sides that have differing opinions.
May I make a comment as well to Senator Mizell's comment? I appreciate your comment. And I had actually left what you would call big box medicine for this reason. Overwhelmingly, there's a trend of care dictated by population health, and that is then policies are created by organizations, a small group of individuals in organizations that is then broadcast out, and physicians like ourselves in the trenches are just basically hit with a lot of information all at once in policy format. It does become increasingly difficult to practice medicine when you're told by your employer that these are the benchmarks you have to check off. So that's actually the reality of what's happening nowadays, and that's why you see a contradiction in what perhaps is shown either in mainstream media or by our organizations, and then why you see frontline doctors like ourselves saying something different.
Thank you all for your testimony. Thank you all for being here. Appreciate it. Okay, I'll just take these cards kind of in the order that I have them. Donna Lambert would like to speak. Vicky Cloutier would like to speak. Quinn Van Meter, MD, American College of Pediatrics from Atlanta, Georgia. I think you spoke already. Yes, okay. Julie Sandiford. You wave? Okay, thank you, Behrman. Chris Alexander. Not here? Okay. Katie Alexander? You wave? Okay, thank you. Christy Hike? Okay. Okay.
Would it be appropriate for someone turning in green card wants to speak to see more time to Dr. Van Meter?
We can't. Let's see what we got, because we got a lot of people in opposition. We got a full agenda. I mean, I think we're giving everybody a good hearing. Okay, let's keep it at the 3 minutes. Okay. Anybody wants to speak? It's all yours.
Okay. Hello. My name's Donna Lambert. I'm here from Baton Rouge, and I'd like to speak with you. I'm a mother, and I also speak for over 3,500 parents in a parent group that I co-founded 2 years ago. They're from all across the country, including Louisiana parents. Since 2016, my child turned to gender identity for the solution to her problems. I've watched gender-affirming care sweep the nation. thousands of parents I've spoken with are walking this road with their families. Parents are desperately trying to keep their kids safe while professionals, trusted adults, peers, and society are telling them their families hate them for not jumping to affirm their new identities. This causes a divide between parents and kids. The turmoil skyrockets further the moment professionals add the dreaded line, "If you do not affirm, you will be the cause of your child's death." It's impossible for parents to make a rational decision when professionals make these accusations when they have doubts. The parents follow along out of fear. My family's experience personally is like many others. We were caught completely off guard when we received a scripted email filled with language I had never heard come out of my daughter's mouth before. She gained rock star popularity when she publicly posted an announcement on social media. It was identical to others recently posted by her peers. The euphoria of her social transition wore off within months, and she craved the next step, medical transition. When that step came, I received a text message that she was starting cross-sex hormones. The next morning, I received a call that she had been found unresponsive and was in a county mental health facility several states away. In the days that followed, I tried to find out where she was and in what condition she was in. When I received a phone call from her, she was very emotional and shouting. I tried to calm her so that I could understand what she was saying, but she hung up the phone. That was the last time I heard the sound of her voice. Over a year passed before I received a text message that said, "Hi, Mom. I hope you're doing well." The next time I saw her, she was on a social media post recording the changes in her voice and her appearance. I did not recognize my child or the sound of her voice. It's been 3 years since I got the call from that hospital, and a lot has changed, but my love for my daughter has not. She told me, "Through all this, Mom, you always made sure I knew you loved me." So, when mental health professionals told me that if she killed herself, I would be the cause of her death for not believing she was born in the wrong body, I didn't accept that ridiculous statement. I raised her and know she is not so fragile that hearing her birth name will not cause her to crumble and take her own life. She was struggling and needed psychological help. She got gender-affirming care. She was given testosterone, a Schedule III controlled and addictive substance. My story's not rare. I wish it was. This bill is not about hate. It's about courage. Will the committee have the courage to speak truth about the fundamental reality of a human being? I ask favorable passage of 648. Let's not let another Louisiana resident have transition and ask, why was I allowed to do this? Thank you.
Thank you for your testimony.
Thank you so much for allowing us to be here. Vicki Cluche, I live in Schriever. I just want to speak briefly about compassionate care and common sense for the child who's beginning to think that he or she might be transgender. I read that an adolescent is defined as 10 to 19 years old, 19 years old, still an adolescent. Watching my kids grow up, I can attest to this. They were on their way in junior high and high school, but were far from adults. They were still adolescents. And honestly, I didn't see real promise from them until around age 25. Now I understand that their frontal lobe wasn't developed until around 25, so I'm giving them a break on that. But, what happens when kids start feeling this way is they turn to the internet. And it's interesting that kids are very, very good at navigating the internet, but they're very naive in what they're finding on the internet. And when they go onto these sites, they find there's a wonderful world of transgender, and they are accepted, and everybody is for them, unless and until they change their mind, and then they hate them, and they come against them. It's very, very sad. So we want to see compassionate care and common sense. Why not walk with these kids through this situation and through this time of their life? Let them slow down. be a child, work through these things. We've all been through adolescence. All of us were uncomfortable with our bodies. All of us wondered if we were normal, if anybody liked us. It's not unusual. So we need to give them the time for that. And I just want to read a quick excerpt of a letter from a Louisiana parent. She says, "Every girl in my son's 8th grade class identifies as something besides female. Most of the class has been attending school together since kindergarten. We are not religious and are accepting of the LGBT community. An entire class of 8th grade girls being trans seems odd to us, but we are going along because we do not want to offend longtime friends. Affirming every kid seems reckless, especially when we have watched our older child's peers go from social transition to medical transition by high school. It all seems like a fad to us." We believe that if we will tell the truth and allow the children time to grow up before they make a life-altering decision, that they will thank us when they come to the realization of who they really are, that they are in the body that God created them to be in. Thank you.
Thank you for being here. Yes, ma'am.
Good morning. My name is Christy Hike, and I'm with Louisiana Conservatives, and I appreciate Chairman Mills' the attention today to this issue. I just want to preface my statement by saying that I am a non-judgmental person. I love everyone, and I just am all about the truth. And that's what I hope we recognize here today. Since the creation of man, there's been and is a biological reality. There are only 2 genders, male and female. Until quite recently, that was not disputed. However, technology, humanity, and capitalism have intersected in a very glamorous global ad campaign that has been generated by pharmaceutical and tech giant elites. This campaign normalizes a false human biology. It has been touted as a civil rights movement, LGB, with the addition of a T on the end of it. The step from transgender to transhuman is not so wide. If we are willing to mutilate our bodies, why would we be unwilling to mesh them with artificial intelligence? And isn't that the ultimate goal? At least that's what the elites tell us. They don't hide it. They have normalized the deconstruction of our human sexual reality, and in so doing, staged the biggest political coup in history. But why and who? As with most any issue, one need only follow the money to answer the why question. There is a big agenda with money and interest at the apex of the transgender triangle. Jennifer Billick, who has done years-long extensive research on this subject, has found that there are exceedingly wealthy men with enormous cultural influence who are funding the transgender lobby and organizations. These include, but are not limited to, Jennifer Pritzker, a male who identifies as transgender, George Soros, Martine Rothblatt, a male who identifies as transgender and a transhumanist, Tim Gill, a gay man, Drummond Pike, Warren and Peter Buffett, John Stryker, a gay man, Mark Bonin, a gay man, and Rick Whelan, a deceased gay man whose philanthropy is LGBT-oriented. These billionaires fund the transgender lobby and organizations through their own multiplicitous corporations. They and others, including pharma and big tech companies, are sending millions and millions to LGBT causes. The overall consumer market of LGBT is now $3.7 trillion. That is enough money to change laws, change language, forcing new speech on the public, to censor those not in agreement, and to threaten those who are not in compliance with this new gender identity. Only a negligible fraction of this mega money trickles down to assist people who identify as transgender. The money goes to governments, technology, and pharmaceutical corporations to institutionalize and normalize transgenderism. In the name of money and evil, we are changing what God perfectly created by mutilating our children's bodies and their innocence and telling them it's normal. I pray that we will not turn our face away from God, so He will not turn His away from us. Thank you so much for the time.
Thank you, Ms. Hike. Thank you all. We do have a question. Senator Boudreaux?
Ms. Hike, you referenced at the onset of your comments that this is a civil rights deal. Can you connect the dots for me on
Well,
that?
LGBT, they just the rights of the gay and lesbians. It's civil. I think they themselves say that it is a civil rights issue. That's not my idea.
You have a problem with what they feel?
No, not at all. That's why I prefaced, no, not at all.
Okay, that's
But
what I needed to connect with your
no,
comments.
I do not have
All of those people on that list you name, I don't know any of them, and I don't know where that money is going. But
right. No, I
just when civil rights come up, it's close to home for me.
Sure.
And I want to make sure that we respect everybody's rights.
Absolutely, and I do. And I'm glad you said that,
Wanted to
Senator.
clarify.
Thank you.
Mm-hmm.
Thank y'all both. Thank y'all for your testimony.
Thank
The board
you.
is clear. I'm just going to take it in the order I've received it. So Holly Royston would like to speak. Matt Sharp would like to speak. And Jill Hines would like to speak. Matt spoke. I'm sorry. Okay, Matt spoke. Okay, let's get somebody else. Thank y'all for telling me. Fiona Trapani, I always mispronounce your name, and I'm sorry. I know you, but I just forget you. I don't pronounce your name right. So if y'all three could come up, we look forward to your testimony. Thank you. Oh, two. Okay. We got one more then that would like to speak. Sheree Champagne, are you here? Okay. And unless I'm missing somebody, that's the cards of support that would like to speak. So I'm missing somebody, please let me know, because there are a lot of cards I'm trying to juggle here. Oh, Will Hall? Okay, I didn't see yours, Mr. Hall. So we'll have you next, Pastor. The floor is yours. Thank you.
I'm Jill Hines. I'm co-director of Health Freedom Louisiana. We're a consumer and human rights advocacy organization. And we stand firm in our stance that no one in Louisiana has a right to harm any child. States across the country are instituting measures to protect minors from harmful and unnecessary interventions pushed by politicized medical associations and interest groups for profit and to advance radical social agendas. For example, Idaho created their Vulnerable Child Act. Montana instituted a Youth Health Protection Act. Closer to us, the Texas Attorney General has declared sex change operations on minors to be child abuse. Arkansas recognized in statute that these medical procedures, when performed on a child, are medical malpractice. Mississippi recognizes the experimental nature of these procedures and protects minors by implementing the Regulate Experimental Adolescent Procedures Act. In Alabama, it is a felony for a doctor to prescribe puberty blockers or hormones or perform surgery to aid in the gender transition of people under the age of 19. We are surrounded by states that took action to protect minors from these medical procedures. HB 648 will prevent Louisiana from becoming a sanctuary state where minors across the country in Midwest and Southwestern regions of the country travel to receive harmful medical care. And for that reason, and for many more, we support HB 648.
Thank you, Ms. Hines. Yes, ma'am.
Hi, I'm Fiorella Trapani, co-director of Health Freedom Louisiana. We should not be surprised that there's so many, the incidence of children identifying as trans or confused is increasing. They're being bombarded with this messaging in cartoons, in the schools, and remind you, we get children, we can get them to believe in anything. They believe in Santa, they believe in the Easter Bunny. So what do you think is going to happen when they have teachers, when they have cartoons telling them, oh, if you like this, maybe you're really a boy, or if you like this, maybe you're really a girl. That's why they're confused, okay? And we know that children do not have the developmental capacity to make these important decisions. That's why they can't drive, they can't work, they can't drink, they can't buy cigarettes. But we're somehow going to say that they can have the capacity to make a permanent decision to chop off a healthy body organ? That doesn't make sense, okay? You have Children's Hospital in New Orleans with their little gender clinic thing, but at that same hospital, you have Maria Isabella Pontanero. She is a social worker with a master's, and quoted in January of this year, said kids' brains don't fully develop until their mid to late 20s. So we can't expect them to process danger cues. We can't really expect them to process, healthy decisions. Kids end up being more vulnerable, partially due to their brain development. But yet we're going to believe the AMA or other doctors that say, no, they are developmentally correct and ready to take on these decisions from which there is no turning back. These are permanent decisions. And lastly, another contradiction, pointing to your previous comment, Chairman Mills, why would we, quote unquote, affirm these ideas that they do not feel comfortable in their body and so their body doesn't match their feelings? I had sent this picture to the Senate committee email for permission to show it, and I can leave it with you. But would you affirm an anorexic girl's her body dysmorphia by encouraging gastric bypass surgery, or if she wanted liposuction? That would be medical malpractice, okay? So when these children, if they have these feelings or these thoughts, yes, they do need help. They do need treatment, but not in the way of mutilation and permanent puberty blockers that are experimental. They are not guinea pigs. They are our children, and they need to be protected. So please do the right thing and protect Louisiana children. Thank you.
Thank you very much. Yes, ma'am. Oh, a question? Okay. Senator Pope?
Thank you, Mr. Chairman. I just have one question, and I'd like to direct it to you and your comments, if you may. You made a statement that this is coming into the schools. Is that correct?
Yeah. Yes, sir.
Do you have a list of those schools? Do you have a list of those teachers? Do you have whatever? Because you're talking to somebody that's very much aware of what goes on in the school systems. And I'm not aware that we go out there and we advocate this in the schools. If we are, somebody needs to know about it.
Well,
No, I don't know. I'm asking.
Well, what I mean is, it is an issue. I don't have a list on me. I could provide one because we hear from parents, and there's actually a bill right now that is trying to address that issue.
Look, I'm going to support this bill. I'm all in favor of this bill. That's not where I'm going. Okay. But I don't want us to sit here, and I'm not going to let you sit here and be negative to a group of people that I've supported for a long time when 98% of them are doing the right thing. There's always that 1%, 2%. I get that. Okay. Just need to know who they are. If you got the list, I'll take it.
I would be happy to provide it to you.
I would be glad to get it. Thank you, Mr. Chairman.
Thank you both. Yes, ma'am.
I'll get you that list. Hi, I am Sherry Champagne. I am from Homa. I am certified in adolescent behavior. I am also a child and victims advocate, the founder and director of You Be the Change. And I can get that list to you for the schools that do implement the gender identity, gender dysphoria, and all of the information that comes with that. First and foremost, every one of the folks here that spoke before me are absolutely correct in everything that they've said. But many of them have not said where we are seeing this and why are we seeing this. This is being taught in our schools. It was actually injected into our schools through the SEL programs in our school system. We are currently now in almost every school in Louisiana having separate lessons within the SEL curriculum that is actually teaching the gender identity and gender issues with children. They are going into the counselor's offices individually. They are actually being told that they are or have gender issues. So it is actually in our school system. I would be happy to provide all of you with the information, but if you have schooled yourself on the SEL in our school system, you would understand that it is about data. Without the data that we got from the SEL program in our schools, we would not have the patience for all of the pharmaceuticals, for the transitional surgeries, and for the procedures that we are now seeing that has been approved by our government. Without this funding, this would not be an issue because we went from possibly one transgender or gender identity confirming clinic to more than 100 in a matter of the time that it took to have the funding approved. So when we talk about this, we have to first address if you are above 18 and you choose to be transgender, that is fine. We are teaching this in our school system, which is why we see the enormous amount of transgender children or gender confused children. All of that is in our school system. We approved it when we allowed the SEL programs into our schools. So in order to stop that and the influx of transgender children, we must address what is going on in our school system and in the funding, and do not join in on allowing our children to be for sale for every doctor, counselor, or psychiatrist that has joined in on the funding aspect of this agenda that is being pushed throughout Louisiana and throughout the country. So we please implore you to make the right decision and disallow any type of child mutilation in Louisiana, and it is up to you to do that. So please do. Thank you very much.
Thank you for your testimony. Thank you all for being here. Yeah, that'll be fine. Dr. Hall, I'm going to have to put you in timeout. You filled the card, but you didn't tell us what you wanted to do. You know better than that now. You've been here enough. So we have Dr. Hall and Holly Royston. So I thought I forgot you, but we're going to put you in timeout.
Hi, Mr. Chairman, thank you for being so gracious.
Completely blank.
I'm Dr. Will Hall, and I'm the Director for the Office of Public Policy with the Louisiana Baptist Convention. I represent about 1,600 congregations. And, Mr. Chairman, with your permission, I'd just like to hand out this study, if you would, please. We've talked about the research, and I just thought it'd be good for you to have it in hand. Want to point out and make clear that this bill is not directed at adults. It's meant to protect minors, those who are emotionally and mentally incapable of giving informed consent on these serious procedures. And I'd like to point out that we've seen in the United States 1,000% increases in cases of gender dysphoria. Sweden has seen a 1,500% increase, and the UK has seen a 4,400% surge in gender dysphoria cases. Those 4 countries have taken action as countries to protect their children. UK, Finland, France, and Sweden. In fact, Sweden took these steps, although they're the pioneer of these procedures, both surgeries and hormone therapy. They did it for 3 reasons, basically. 1, the surge, which I mentioned, 1,500% in a decade. 2, the flip. It used to be that primarily it was rare, but primarily there were just males who were confused in gender, young males. But now it's almost predominantly females. They can't explain that. And then after looking at the research, they found that there's no evidence that shows that these procedures help young children with their confusion. Additionally, the Sweden National Board of Health and Welfare has declared that these procedures are experimental. I think it's important for us to go to the science on this. We have 4 countries that looked at the science, and they've taken the precautions of protecting their children. And then finally, I would just ask you to look at that research. I don't think I kept one for myself. But if you look at the conclusions, you'll see that the morbidity rates were extremely higher for those that had the surgeries and had the procedures than those that did not. And they've concluded that these procedures should not be done or should not be performed on minors. And if you look at that, that's a 30-year longitudinal study. So I think the science is clear. I hope that you will follow the science and pass HB 648.
Thank you for your time, Dr. Hall. It's been a pleasure working with you. Thank you. Yes, ma'am.
Thank you for having us. We have all the studies. We have everything presented.
State your name for the
you.
record, ma'am.
Holly Royston, Iberia Parish.
Very good. Thank you.
We presented everything. They'll go into detail. They'll give you pages. They'll give you studies. You'll hear both sides. But to be honest, do you think this child is old enough to make her own medical decisions to mutilate her body? And if you feel she does and you vote to not pass this bill, shame on you. Shame on you. And that's all we have to say. God bless and have a good day.
Thank you very much. So, ladies and gentlemen, unless we're missing somebody on the proponent side of the bill, that it supported the bill. I think we've heard the testimony from everybody. Is there anybody that I've missed? Because there's a lot of cards and I'm trying to jumble it through. Is there anybody that we've missed? Okay, well, in that case, we'll start the opponents to the bill, and we'll start with Dr. Clifton Mixon. Yes, sir? Okay, who else want to speak? Okay, well, I can't yell. I got him. I mean, if you're not here, you're not here. You know, we want to be fair, but if you're not in the building, we can't start waiting for folks. And we're looking for new testimony, really, for right now.
Yes,
Please.
I have something. I have
Okay,
something new for you.
please. Who are you? Please?
Hi. Yes, my name is Paige Laurie. Thank y'all for allowing me to come up and speak today. I'm going to speak actually to the parental rights aspect. I think it's going to be really important that this committee understands. In the current state of Louisiana, there's a current statute on the books, that the minor consent statute, that is, you're going to hear a lot of opposition today about parental rights. So this is why I want to speak to this. So I'm just going to go ahead and start. For any parent that feels HB 648 will infringe on parental rights, your rights have already been stripped from you. Louisiana currently has no lower limit on the age of medical consent. In short, this means a minor child may walk into any healthcare provider or facility to receive care without parental knowledge or consent. Medical professionals, by law, can and will exclude parents from the medical decision making for your minor child. Parents in Louisiana currently have no right or say in their child's healthcare decisions. Furthermore, physicians are protected from liability from relying on the consent of the minor. That is the Part V, minor's consent to medical treatment and related procedures supporting a minor's consent, miscellaneous provisions. All of you should have received an email from me pertaining to this information, and I'd like to be given some consideration. Why is this important? Well, this is simply important because if you don't pass this bill, kids do not need their parents' permission to receive this treatment, according to our current state law. So I hope you take that into consideration. If you have questions for me, I'm happy to take those. Thank you.
This concludes the proponents of the bill, and we've put into the record who testified. It will be in the minutes of everyone that filled out a card that's in support, so it will be noted in the minutes. And now we'll start the testimony for the. Oh, I'm sorry, Senator Boudreaux.
Mr. Chairman, just 2 speakers ago with her daughter, I just want to just clarify if that's all this bill did was. I'm not in favor of someone under 18 doing a lot of things, but if that's all this bill did, this would be an easy vote. There are a lot more things in this bill than just the parental rights and everything else. So and we're going to listen to both sides of this issue, but if that's all it was, I think everybody on this committee, it'd be an easy vote that no one on this panel believes that someone under 18 years old needs to make a life-changing decision. But that's not the entire bill. We have some other things in here that we need to hear from and consider. I think the chairman said it earlier. Even within the medical professional community, there is some dissension. So before the opponents come, I just wanted to say that with all due respect, I don't know anyone who would believe that someone under 18 should make that decision. But that's not as easy as it is today. There's a lot more when we talk about the life of that child. So thank you for that opportunity. Now I'm welcome to hear the rest of the testimony this morning.
Very well said. So what we're going to do, committee members, is like we did in the first panel, we called up physicians and people that were in this field. So I'll do the same thing. We've gone through the cards. I'm looking at MDs, PhDs that are in this. So to be fair to all sides, we'll call up the professionals that deal in this arena on the opponent side. So first I'd like to call upon Clifton Mixon, PhD, Jennifer Creedon, MD, Dr. B.C. Egan, And that would be the first panel, if you could come up. And I guess to kind of set the same ground rules, let's talk about the bill itself, and let's talk about your opposition to sections of the bill. And because we gave the other side a little bit more latitude on the presentation, for the physicians in this group, we'll go 5 minutes with yours, and then the general public will go 3 to be very fair to all sides. That way, everybody, I think, had the same opportunity.
Mr. Chairman, you'll give their physicians 5 minutes each.
No, I'm saying 5 minutes for the first presentation. The first presentation. So whoever wants to take the first 5 minutes, let's go from there, and then we'll go from. We'll try and. I'll try and make sure everybody. I want everybody to get a fair opportunity to testify. So, Dr. Mixon, you want to be first?
Sounds great to me.
Okay, it's all yours. Let's go with 5 minutes with Dr. Mixon. We'll go with that. 5 minutes.
Wonderful. Chairman Mills and Senators of the state of Louisiana, thank you for letting me testify today. My name is Dr. Clifton Mixon. I'm a child and adolescent clinical psychologist who's licensed to practice in Louisiana and Mississippi. I work in a gender clinic that prescribes gender-affirming hormone therapies to youth. And so far, I'm the first provider to come to this table today who is from Louisiana with experience working with this population. So far, we've had 3 providers from Louisiana who are a pediatric allergy and immunology expert, a developmental pediatrician, and an OBGYN. Our endocrinologist from out of state has previously been ruled in February of 2020 to be discredited as an expert by Judge Jermaine Tanner of Harris County in a case in which parents had a divorce proceeding on whether or not they could proceed with gender-affirming care. The case is sealed, but one of the lawyers had said that the judge compared Van Meter's testimony to a chocolate Easter bunny. It looks great on the outside, but you can penetrate it, it's hollow. So his experience is not particularly relevant in this conversation. So a little bit about so at the heart of this debate is mistrust in our medical and mental health providers to provide ethical and individualized care without prejudice and based on best practice and established research. I'm here to address these concerns. In opposition to a mean-spirited bill that defies science and humanity, I'm here to oppose HB 648. The evidence is clear. Gender-affirming medical interventions are safe and effective treatment for gender dysphoria and resulting mental health problems for many trans youth. Unfortunately, you have been exposed to false information that misrepresents the established research and practice guidelines on gender healthcare and medicine. I am here with actual studies that I can help you show to you and provide the facts. I have a doctoral degree with training in how to conduct and interpret research and plenty of patience to take your questions and help discern the truth amongst the conflicting information. I know this has to be really confusing. So these medical interventions reduce risk for suicide and improve overall mental health functioning and quality of life. We're not providing access to youth for whom this is not appropriate. The success of our guidelines is supported by research, all showing high rates of treatment satisfaction and low rates of regret, less than 1% for the adolescents who we provide this medication to. You can read all about the benefits of gender-affirming healthcare in the Louisiana Department of Health report requested by this bill's author. LDH did a great job, and this well aligns with existing research. I welcome questions about that after my testimony. So our practice and decision-making in this area is built on well-established standards of care based on established research and endorsed by all major medical and mental health organizations. You all should have received an email that has about 20 position statements from major medical and mental health organizations across our country that highlight the importance of gender-affirming care for youth, including medical care. European countries are not banning gender-affirming care en masse. Their provision has become more judicious rather than prescribing hormones as the standard of care. England has decentralized gender-affirming care from one clinic where all kids in England had to go to putting it to the local communities where they're working in multidisciplinary teams with local providers like pediatricians and mental health professionals. They did not stop providing gender-affirming care. Sweden did not stop providing gender-affirming care. Instead of being a standard of care for all youth who ask for it, they advised a more judicious, individualized approach, as is the recommendation. I would like to make one thing clear. No provider I know of in this state is trying to turn kids transgender. We are trying to allow transgender kids to grow up and become trans adults by improving their quality of life and preventing premature death by suicide. Our approach counsels youth and supports them to figure out who they are and what is needed for them to live with a healthy quality of life. Sometimes this means that they aren't transgender. Sometimes it means that they are, but will be fine with non-medical changes such as to their name, clothing, or hairstyle. When we decide hormones are an option for a family to consider, we do so because the patient's gender dysphoria has been persistent over years and is causing considerable impairment to their daily functioning and/or risking their life. Intractable anxiety and depression resulting in cutting, recurrent suicidal ideation and attempts and psychiatric hospitalizations, truancy and academic decline, social withdrawal from friends and family, or all of the above. When families and providers make the decision to prescribe hormone therapy to these kids, we do so because we have exhausted all other options available, interventions including psychotherapy and psychiatric medication. When we prescribe hormone therapy to these kids, they get better. They stop cutting, they want to live. They go to school, they get better grades, their relationships improve, and they can begin to live a more normal teenage life. These are the scary side effects of gender-affirming medicines. I'm here to tell you, we know what we are doing. We are following established research, best practice guidelines, and our ethical codes, and we are doing so with an awareness of the importance of our role in supporting safe exploration and decision-making. We are doing so with the best interest of every child and family member. If this bill passes, we will lose one of the most important tools in our toolkit to help some of these kids who've exhausted all of their options.
Thank
and
you,
I can
Don.
tell you that some of these patients will die by suicide. Please help me protect my patients.
Thank you for being here.
Thank
and
you.
there may be some questions. Yeah, now we're going to 3 minutes. Yes, yes.
Hello.
Oh, Jay, I'm sorry. I'm sorry. Senator Luna had a question. Senator Luna.
I do. Thank you, Mr. Chairman. One of the, I heard you, it's Dr. Mixon, is that right?
Yes, sir.
I heard you make a comment about when you said when families decide things like about hormone therapy. We all know that a child under 18 years old cannot have a surgical procedure without the consent of their parents. Is that the same thing with things like hormone therapy?
For hormone therapy, we require parent consent. I cannot speak legally to what would be possible with the law, but we require consent in accordance with best practice guidelines, which suggest parents are required and critical to this decision-making process.
All right, thank you.
So we is basically your practice and where you work? Is that your guidelines?
Yes, sir.
Okay. Okay, very good.
Parent
Senator
consent is required.
Okay. Senator Boudreaux?
Yeah. Thank you, Mr. Chairman. So Dr. Mixon, he just asked, when you said we, so tell us again where you're affiliated with.
I'm affiliated with the Pediatric Gender Clinic in New Orleans. I work with a pediatric endocrinologist and a social work to provide multidisciplinary care.
Yeah. So normally, when we have a stack of opposition cards, people fill them out and they run away. Okay? They're against it, but they don't say why. So I appreciate you and everybody else who's opposed to it, but I want to know the whys. I want to know why. You said this is a difficult thing. I've gotten a lot of emails. In fact, some people who I didn't know knew me sent me some stuff about this. And you referenced the LDH report. And as I read this bill, it's like I said earlier, if it was just about 18 years old and a parent making a decision, it'd be an easy vote. But that's not that. The LDH report that you referenced was very long, and I would like you, since you fill out a card in opposition, and you're an expert in this area, and you said, what would be some of the key takeaways from that report? Because you see, we charge LDH with handling this at the state level for us, and myself included. I asked them for all kind of things, and we expect that they have the best interests of everybody in. So my question to you, if you can just give me a couple of the takeaways from that report so we can continue to hear where we're going with this bill and help us in the decision-making process.
Of course. Thank you for the opportunity to talk on the report. The report was designed to answer some questions proposed by the study resolution's author, Representative Furman, last year. And so the questions asked about the gender-affirming care that happens in our state, what is the impact on mental health, ages, rates of prescription. The report is limited to patients with Medicaid. Medicaid is the primary insurer of our state, and the majority of children are on Medicaid, so this does represent the majority of children. So I will highlight that 0 surgeries were ever performed on minors in the study years from 2017 to 2021. This is in accordance with best practices. Some of the surgeries that you've heard mentioned today, such as mutilating genitalia, no one's doing that on kids. That's not allowed on kids. So this study report actually aligns that we're following best practice guidelines. On average, 14.6% of minors with gender dysphoria received some kind of hormone therapy over the study years. So a point made on the House floor was that the total number of minors receiving hormone therapy did increase from 21 to 57 over that period of time, but the percentage of kids receiving hormone therapy actually decreased over time. So as more kids are identifying, we're not seeing this explosion in more kids exponentially getting more medication. So we went from an approximately, in 2017, in 2018, 18.4% of kids with gender dysphoria getting access to any hormone therapy, and that decreased to 12.3%. Again, that's 18.4 to 12.3% by 2021. So the number of providers decreased from a high of 18 in 2018 to 12 in 2021, so providers are discontinuing providing this care. The majority of services provided to individuals who are transgender is in fact mental health care, which is what we recommend as the first line of defense. Psychiatric and mental health outcomes improve after treatment when compared to individuals who are not treated. The medical and physical health outcomes varied across studies, some noting small changes such as increased lipids, but others noting no difference. Regret on or retransition in youth who get access to these medications. And these are the youth who meet the guidelines and standards of care that are based off of research. Those kids, when we give them access, less than 1% regret it. The majority, that is amazing treatment satisfaction. And so we feel really good about our guidelines. One thing I can note is that the ones who regret it, we find are the ones who don't go to an expert, who go to someone who does rush them prematurely through the process. And we know that is possible, just as there are bad actors in all aspects of medicine and mental health who provide care inappropriately. And let's make sure that that falls into medical malpractice where it should, rather than taking away physicians' licenses, and rather than opening up a cause of action for civil suit that the Attorney General can file independently of any injury. Let's
That's
see.
good.
That's
I
good?
wanna, yeah,
Okay.
that's good because I didn't, like I said, I know that the LDH report was long, but when I read the bill and you talk about the hormone therapies and surgeries, and I'm not a medical professional in any aspect, these come across as experimental. So, my question is, are they safe? I mean, and how do, me and the other people who don't understand medicine to the level, how do we know that they're safe and where are we going?
Yes, so these are medicines that are used in other populations of kids, and we've been using them for decades. The estrogen is the same hormone that is produced by the body of individuals who are born with XX chromosomes that naturally are able to produce estrogen. The testosterone is the same as the testosterone produced in the bodies of people with XY chromosomes. The effects are the same. Everyone goes through some kind of puberty, and we know that they do okay with it. So the side effects there are minimal. Surgery is the same as a double mastectomy for someone who might need a breast reduction due to back pain, or who might need a mastectomy for cancer treatment. And so we know that those are safe. And then puberty blockers are used in precocious puberty for individuals who might start menses as early as age 5 to make sure that they can go through puberty at an appropriate time. And so all these medications are safe and used in other populations. And so we see the strong benefits. We see minimal side effects.
Okay, I think that's phenomenal, Mr. Chairman. That's all. Again, I appreciate when you oppose something, you come and tell me why, and it helps, especially in a complex issue like this. That's it for now, Mr. Chairman.
Thank you, Senator.
Thank you very much, Senator Boudreaux. Senator Mizell?
Thank you, Mr. Chairman. I'm listening to your testimony, and it was, I think you said 1% expressed regret.
Mm-hmm.
How much time has passed before you find out? When are you asking them about their regret? How much time has passed with that new identity before you ask?
Gotcha. So it varies from study to study. Some studies only going about 1 year, some studies going as far as 5 years. I'd have to pull up the name of the study. I think it is right here at the end. Sansfasone et al. Published August 2019, in which they...
So can I ask you why you're doing that?
Yes.
So do you follow up with, I mean, like so you have a short-term, long-term
Follow-up with patients.
follow-up process, okay. Because when you mentioned, and before Senator Boudreaux's question, you had mentioned counseling, maybe changing their hairstyle, changing their clothes. How long in your clinic do you work with a young person with those less intrusive, not medical, more strictly counseling? How long does that happen typically before there's a shift to a more permanent?
No, I understand your
Yeah.
question. Thank you, Senator. That's a fantastic question. And so in our clinic, we want to see them for approximately 2 years, having been out socially transitioned and having been in therapy with someone who can help them explore their gender identity and help explore the nuances of asking the hard questions, challenging, like, is this really authentic? How do you know this is accurate for you? Why is it not this label? Why is it not that label? What does this mean? And thinking about the future. And so having been through that time, so we look for approximately 2 years. As all things in medicine, everything can be a little bit individualized, but we don't stray too far from that.
And what's the youngest person you've ever worked with?
And worked with for therapy in a non-medical fashion. I think as young, I've seen a patient who's 6 who's come out. And at that point, we advise the parent to try some non-permanent things at home and kind of just explore safely and spend some time doing that. And so I did not work with this patient for therapy, but they came for a consultation for advice, and I referred them to a therapist who could help kind of guide them and help do some of the exploration.
6, you said?
Would be the
6 years
youngest I've
old.
had a patient come in contact with me who was identifying this way. In terms of medical treatment, it's nowhere close to that age.
Right,
I would
right,
say the
right.
closest that we've ever seen. The youngest we would ever provide any kind of intervention that makes changes to your body, the average age we find is about 16, and in some circumstances we will go down to 15 or 14, but I would say that's exceptionally rare.
And that's the hormone therapy.
That's the
puberty
hormone
blocker.
therapy, correct.
Okay. Thank you.
Thank you, Senator. I
Mr.
appreciate your
Chairman.
questions.
Good line of questioning, Senators. Senator McMath?
Thank you, Mr. Chairman. And if this was hit on and I missed it, forgive me. But how long do you track or follow the patient long term after?
Like me personally, my practice, or in research-based studies?
Well, both.
In my practice. So in my practice, we do follow-up calls. We transition them to the adult side, and so we're able to monitor them through our adult endocrinologist who continues to see these patients, and so we're able to track the data through her clinic.
For what? How long?
Ongoing. I am younger and younger in my career, so the patients I've seen are going to be younger than that. And so, let's see.
What's
in
the
terms
longest
of
you've ever tracked a patient?
The longest I've ever known a patient would be about 8 years.
8 years, and you follow up through that whole period. Is that about average? I mean, or is that just one patient that's that's been an extended period of time?
We keep following, and so some of the patients keep going into their 20s and 30s.
Okay.
And 40s with this provider, and so none of the patients I've worked with have gotten to that point, but patients that our endocrinologists have worked with have aged.
So the oldest patient the 8-year patient is how old? I mean, I'm not.
Would be about the mid-20s right now, 26, 27.
Okay. Thanks.
Mid-20s.
Thank you very much.
And just to clarify, that 5-year longitudinal study was by Princeton, published in May 22 in the Journal of Pediatrics.
Thank you very much. So now we're going to go to the 3-minute rule, and I'll ask the opponents, like I asked the proponents, if it's a duplication of testimony, or you would be basically saying the same thing as these panelists. Let's just, from a time standpoint, we have a lot more work to do, and we want to give this bill a fair hearing. But if you see you duplicating the same testimony, then we'd ask you to waive. But we don't want to deny anybody their opportunity. Yes, ma'am.
Hi, good morning. I'm Dr. Bridget Egan. I am an emergency medicine physician at a level 1 trauma center in New Orleans. We've had a few people talk today about the outcomes of what it takes to get someone on these medications and the studies that support that there are huge benefits to the mental health of these patients. That studies support that suicidal ideation goes down, that self-harm behaviors, things like cutting, suicide attempts go down. That these children, when they're placed on the appropriate course of treatment, whether that is starting with therapy, social transition, and at the appropriate age and part of their development, going through medical transition, that they're happier. They're supported in their families that support their care. They do better in school, like we've heard. What I would like to talk about as an emergency medicine physician in the state is that if this bill were to remove that treatment option that we know works, what will that look like for children in our state that are trans, that are not trans, cisgendered kids? Because in Louisiana right now, if a child goes through a mental health crisis, they will present to our emergency departments, whether that is in their community hospitals, Children's in New Orleans, where I work at the trauma center. They will come to the hospital. And right now there are only 230 plus or minus inpatient psychiatric care beds for children in this state. And as we saw in our LDH study, there are 465 children that identify as trans enrolled in Medicaid. And right now, every single one of our beds is filled with an increasingly high need of mental health care for all children in this state. We know after the pandemic and everything that's been going on in the country over the last several years that the level of stress is high across the board for all children, and the increased need that they have for mental health care is only going up. And what this bill stands to do is to make it so that children that were otherwise stable on medications that help them are now having them ripped away, and they will be presenting to our hospitals and taking up beds that they otherwise would not have needed, which pushbacks the care of everyone else that needs emergency medicine care, that needs psychiatric care, that a child with appendicitis might have to wait longer in a waiting room because that bed is filled with a patient that cannot get into a psychiatric bed for days and days and days.
Thank you very much. And you're referring to page 3 of the bill, lines 10 through 17. There would basically be a reversal of present treatment. Is that correct? Okay, I just want to bring that to the members. Not saying I'm for or against. I'm just telling you that that's what you're talking about.
Yes.
Okay. Thank you. Yes. No. You had your chance. It's time to be quiet. You can talk when you close. And I'm trying to be respectful, but that's not how we do things here. We're not going back and forth like you just take your notes, and when you close, you can talk about it. Yes, ma'am.
Hi, Senator Mills and committee. Thank you for letting me speak. My name is Jennifer Creedon. I'm a psychiatrist, board certified in psychiatry, child and adolescent psychiatry and addiction psychiatry in New Orleans. I work primarily with adolescents, including providing psychiatric and multidisciplinary care to transgender and non-binary youth. I'm also the president of the Mid-Gulf Council, which is the Louisiana state chapter of the American Academy of Child and Adolescent Psychiatrists, and I represent them today as well. And I am here to voice strong opposition to HB 648. As has been discussed, there's a growing body of high-quality research that consistently demonstrates that access to gender-affirming medical care improves mental health outcomes in transgender and non-binary youth. With regards to recent literature, a large-scale study in 2020, which included over 11,000 trans and non-binary youth, showed that those who received gender-affirming medical care had significantly lower rates of depression and past-year suicide attempts when compared to trans and non-binary youth who wanted this care and were unable to receive it. Another study of trans adults found that those who received puberty suppression during their adolescence had lower rates of suicidal ideation compared to trans adults who had wanted such treatment and were unable to receive it. Another study of trans youth receiving medical gender-affirming care demonstrated suicidality reducing by 75% compared to before they started this care. Some of these studies and others demonstrate even more robust improvements in mental health when adolescents do not have to go through a full puberty of the gender they were assigned at birth. And this data supports earlier studies that have been used to make the guidelines that were mentioned by Dr. Mixon in terms of how we assess these kids. The studies that are brought up in support of this bill, claiming rates of desisting, count into those children who never met criteria for gender dysphoria, including kids who dressed in opposite gender clothing as children but never identified as trans. And that studies claiming that there were no improvements in suicidal ideation or suicide attempts compared trans individuals who received care to cisgender individuals, which is not quality science. Just to also address the quote about that adolescent from Ms. Pontiero, who's the social worker at Children's, and her words were used that were used out of context. I contacted her, and she points out that her description of adolescent development was used in the context of children exposed to trauma and trafficking, and those were not meant to be used as words to not support children getting appropriate medical care for their gender identity.
Thank you very much. And you set your own time limit. You did good.
Got to keep an eye.
It's very good. Yeah, thank y'all for the test. Oh, I'm sorry. There is a question by Senator Mizell.
Thank you, Mr. Chairman. I'm just wondering when how many patients do you all how many patients, either of you, because I know you mentioned you gave the scenario of someone coming in the emergency room taking the bed from a child who needed an appendectomy because there was going to be such just a crisis when the children who are currently getting hormone therapies can no longer get them. How many children are we talking about? How many children are you prescribing puberty blockers or hormone therapies to?
I don't prescribe puberty blockers. I'm a psychiatrist. I work as the mental health part of the mental health arm of our assessments and ongoing care. So I don't. These are not medications I prescribe. It's a small. It may be in the LDH study. I don't know if that's in there.
It is.
It is. Okay,
on page
I'll pull it
8,
up.
just so you'll know, Madam Pro Tem, on page 8, it talks about in 2021 of the entire Medicaid population, there were 57 minors that were prescribed the combination of hormone blockers.
So have you seen a change in that? Are you seeing a greater demand since 21?
A demand for what?
For puberty blockers or hormone therapy.
I'm an emergency medicine doctor, so people do not come to the emergency room to start gender affirming
No,
care.
but the comment was that I think you said they're happier. When they get the hormone therapy, they're happier. And that's a huge statement to make to me, to be able to say
that is
this
provided
medication
by studies that we have.
The term
spoken about.
happier?
Not the term happier.
Happier.
If we're going to be pedantic about it, yes. We're talking about decreases in depression,
word.
decreases in anxiety. You know, if we're going to talk about the spectrum of happy to unhappy, yes, that when you are not as depressed, when you are not as anxious, when you're not thinking about killing yourself, I would agree that that means that you are happier in general, yes.
Thank you.
Thank you.
Thank you, Mr. Chairman.
Thank you all. So we'll get a new panel up here. Thank you all very much. Dr. Lauren McClintock, is that correct? PhD? And now I'm going to start going through just the order that I received this in. And really, I'm just going to really ask everybody, because we want to be very fair to everybody, but we just have a full agenda. And just in testimony, this is over an hour. So I'm really going to ask everybody to stay on the bill itself. And if you see testimony that's been already given, would you consider waiving? But we want to give everybody an opportunity. Corinne Green and Olivia Groen. Am I correct in the pronunciations? So please come to testify. Please, whoever would like to speak first, the floor is yours. And as I said, we're going with the 3-minute rule. And if you can take less than 3 minutes, we're good too.
I can go. My name's Corinne Green. the policy and legislative strategist at Equality Federation and also the former president of Louisiana Trans Advocates. I live in New Orleans, and I think I might be the only person in the room who actually is funded by Soros and all those people who are named, because many of you on this committee, I've actually gotten to follow my transition and see the changes in me. The first time I ever came to the legislature, it was before I started physical transition. And since then, you've seen me testify many times at various points, and I've actually managed to make a career out of it, and eventually got hired to do policy nationally at Transgender Law Center. And now I do it in every state around the country with Equality Federation. I have worked on every single one of the healthcare bills, or the healthcare bans that was named as having passed earlier. And I can go into detail about how many of them do so much more than what we've even been talking about here today. But really, I just wanted to share my trans agenda as the high-powered trans lobbyist. You don't even have to be flown in because I live here. Is I have passed 3 laws here in Louisiana that many of you have voted for, expanding access to naloxone, the overdose reversal drug, allowing municipalities to authorize syringe exchanges, and then last year, with Representative Hughes, updating our overdose Good Samaritan statute. Aside from that, we have been plugging away, and this year was the 30th anniversary of Louisiana Trans Advocates and Forum for Equality simply running our LGBTQ Employment Non-Discrimination Act. We didn't pass, you might have noticed. But that is the big trans agenda here in Louisiana. That's what I have been doing as I have grown into an activist and policy advocate. And I'm on year 11, and I'm happy to report that my study of 1 is going pretty well. So y'all can keep track with me, and we'll see what we can do together in the future. But I'm here today to ask you to desperately please oppose this bill. Allow more trans people to bloom and find their ways in this world and to contribute to our state. Thank you.
Thank you very much. Whoever would like to go next?
Hello, I am Dr. Lauren McClintock. I'm a clinical psychologist. I specialize in health psychology. In my brief time to speak, I want to speak about 2 excellent studies that were both published last year in the Journal of the American Medical Association. One of them examines the treatment of physical gender dysphoria through gender-affirming medical care, and the second aims to lessen stigma against transgender youth with the greater goal of lessening the impact of gender minority stress. Peer-reviewed research indicates that transgender youth experience considerate mental health disparities when compared with their cisgender peers. This includes rates of depression, anxiety, and suicidality. These disparities have been attributed to 2 processes, gender dysphoria and gender minority stress. Gender dysphoria refers to the distress related to one's body developing in a way that is incongruent with one's gender identity. Gender minority stress refers to the ways in which society's mistreatment of transgender people negatively impacts their mental and physical health. Gender minority stress includes 2 processes: external, which is experiences of discrimination, rejection, and violence, and then there are internal, which are expectations of rejection, concealment of one's gender identity, and internalized transphobia, which could also be called self-hate. Because of these many reasons for mental health disparities among transgender youth, reducing these disparities requires a multi-layered approach. So the first study that I wanted to discuss was conducted by Tardoff in 2022. The study demonstrated promising results in improving transgender youth mental health through the provision of gender-affirming medical care. This cohort study consisted of 104 youth seeking care in a multidisciplinary gender clinic. They examined how the recipient of puberty blockers and gender-affirming hormones was associated with changes in depression, anxiety, and suicidality across the first year of participants receiving treatment. A substantial percentage of the youth in their sample experienced high rates of mental health challenges at baseline. 57% had moderate to severe depression, 50% had moderate to severe anxiety, 43% reported suicidal ideation and self-harm. Tardoff and colleagues found that accessing puberty blockers and gender-affirming hormones was associated with 60% lower rates of moderate to severe depression and 73% lower rates of suicidality. As a clinical psychologist, it is my contention that medical intervention alone is not sufficient in addressing transgender youth mental health disparities. So although evidence supports gender-affirming medical care and improving mental health, other mental health determinants should also be addressed. And this brings me to the second study that I want to discuss. Anselam and colleagues in 2022 addressed the second determinant of mental health by conducting a randomized clinical trial examining the efficacy of a brief video intervention, reducing transphobia and depression-related stigma. They found that, I'm sorry.
Thank you, and thank you for your testimony. I appreciate you being here. Yes.
Hi, I'm Olivia Gowan, Orleans Parish. So this bill seeks to ban treatment that has been recognized as medically proven, necessary, and life-saving that is endorsed by the following organizations: American Academy of Child and Adolescent Psychiatry, the American Academy of Dermatology, the American Academy of Family Physicians, the American Academy of Nursing, the American Academy of Pediatrics, the American Academy of Physician Assistants, the American College of Health Association, American College of Nurse Midwives, American College of Obstetricians and Gynecologists, American College of Physicians, American Counseling Association, American Heart Association, American Medical Association, American Medical Student Association, American Nurses Association, American Osteopathic Association, American Psychiatric Association, American Psychological Association, American Public Health Association, the American Society of Plastic Surgeons, the Endocrine Society, the Federation of Pediatric Organizations, GLMA, which is Health Professionals Advancing LGBTQ Equality, National Association of Nurse Practitioners in Women's Health, National Association of Social Workers, the National Commission on Correctional Healthcare, the Pediatric Endocrine Society, Society for Adolescent Health and Medicine, the World Medical Association, and the World Professional Association for Transgender Health. So, there's a clear consensus. This is medically proven. This is efficacious. We're not going to scare you with poor readings of odds ratios or conflating long-term studies and saying that there needs to be double-blind randomized trials, because that's also very hard for treatments that are on human beings, that are life-saving, and we already know that they're effective. And I think that the supporters of this bill believe this evidence, even if they don't understand it. I think they believe it, that we're happy. I'm a happy trans woman. And this consensus, I think, scares them. Maybe they don't like us. Maybe they don't like how their children have changed, or their peers, or society around them. But this consensus is frightening to them. And I think it's easier for them, instead of passing a bill that outlaws us, to get us to execute ourselves. Because suicide rates are very high among trans individuals. And it's only really high, not because of who they are, but because of the world they find themselves in. There are many studies that have documented that a change in environment that is supportive, loving, and affirming saves lives, transgender lives. So this bill will ban life-saving medical care. Thank you.
Thank you all for your testimony. Appreciate you all being here. Let's go with the next round of panel discussion. Opponents: Casey Filson, Kathleen Hyde. Kathleen Hyde waves. Okay. Annette Bazile. Okay, thank you. Thank you very much. Charles Preston, MD. He left? Okay. Dr. Jesse Lambert. Yes, okay, the floor is yours. And we have room for one more. Jessica Eberhard. Is that, if I'm saying any names wrong, sometimes I don't see those names in Brobridge, so I'm trying. Okay, Doctor, would you like to speak first?
Certainly, Senator. Mr.
You can
Chair.
put the mic down, it'll help you.
Gotcha.
There you go.
Mr. Chair, members of the committee, my name is Dr. Jesse Lambert. I am a psychologist, and I represent the Louisiana Psychological Association. I want to thank you all for giving me the opportunity to testify today. And I'd like to start off by saying that I understand the gravity of this. This is a hard decision, and I don't envy any of you. My purpose here is to talk about some research, and some of that has already been discussed, so I'm not going to go into that, but also to talk about what this bill would do to our ability to provide care and to meet our standard of care. So a lot of research has been discussed, and scientifically sound research, which demonstrates that this is a true phenomena and that individuals who are trans have suffered greatly. Citing from the American Psychological Association, we have data which indicates that individuals who are trans experience more victimization, be that bullying, be that acts of violence occurring in school. They feel more ostracized, more isolated, and this generalizes into relationships, including close family relationships. I echo the data that indicates the greater likelihood of psychiatric morbidity, including self-mutilation and suicide. And I also note research, again, endorsed by the American Psychological Association, that shows greater degrees of satisfaction and resolution of these issues, and that this isn't immediately about going to a biological treatment modality, right? So we're talking a model of triage. So individuals with different issues have different levels of intensity. And in triage, we try to meet those levels of intensity with the lowest restrictive intervention and then going up as severity increases. So for example, if I cut myself doing some yard work, I'm going to get some Neosporin and put it on my finger. If I have a open fracture, I'm going to the emergency room. So I use that metaphor and that comparison to state that we're not automatically jumping to biological modalities. As has been previously stated by other clinicians and researchers, is often cases of psychotherapy, treating it from a mental health standpoint, psychotropic medications, and then allowing for social transitioning can produce great change. I'd also like to talk about what this bill does to the ability for psychologists to meet their standard of care. If this bill should pass, psychologists would not be able to take part in often a team-based approach involving endocrinologists, psychiatrists, pediatricians, and making that contribution to an individual's care from a holistic standpoint to address these issues. So I'm going to be brief. A lot of the research has been covered, and I yield.
One thing, since you're our last physician in here, I'll make this real quick.
Psychologist, sir.
Psychologist. And maybe you can't answer this question, but from lines, on page 2, from lines 5 through 11, it talks about the drugs that would basically not being able to engage in if it alters the appearance of a minor. Gonadotrophic releasing hormone, I can go through it all. Synthetic drugs, stopping luteinizing hormone, follicle stimulating hormone. Those, I'm not going to put words in your mouth, but those are all FDA approved drugs, right?
Sir, I defer that to my more medical colleagues.
Okay, I'll ask that question later. Thank you
Certainly.
very much. Thank you for your testimony. Whoever's next it's all yours.
My name is Jessica Eberhard, and I live in Baton Rouge. And my husband and I are parents of 2 teenagers, one of whom is transgender. And I'm here to speak regarding this bill, which would directly impact our child's medical care. I want you to think about what our experience has been as parents, because it could just as easily have been yours. None of us expect to have a transgender child, but if by luck of the draw one comes into your life, then they're yours to love and to protect, and you do your best that you can to help them grow and flourish and become the best adults that they can be. My husband and I have done a ton of reading. We've had many discussions with medical professionals, psychologists, clinical social workers, and endocrinologists, and all along our number one goal has been to make the best possible decision for our child and with our child, to consider their long-term well-being and to prioritize their mental as well as their physical health. If this bill passes, the resulting law would take away our family's right to follow the advice of healthcare professionals and give our child the care that is recommended by our country's primary medical associations. It would not allow our state's healthcare representatives or professionals to follow best practices in their fields, and it would not allow my family to follow best practices in caring for our child. Data show that the consequences of not following these recommendations can be profound, as in life or death. This bill includes some hot-button prohibitions like prohibiting sex change surgeries on minors, but best practices don't include those surgeries for minors. If you're concerned about such extreme interventions, then I would encourage you to amend this bill so that medical care for transgender minors is aligned with best practices supported by major medical associations in our country. Please allow these professionals to offer the best possible care for our children. Thank you.
Thank you very much.
Hi, Casey Filson of New Orleans. I feel like it's important to kind of bring this to the most human level possible, and I want to talk about my wife. My wife and I have been together for almost 10 years, and she's the most interesting, compassionate, beautiful, loyal, smart person I've ever met. I'm sure a lot of you feel the same way about your wives and partners. She's done a million different things in her career. She's wonderful, and I think she's also trans, which is, I think, arguably the least interesting thing about her. She's known that she's a girl. She's known that she's a woman since she was a child, which is a story you'll hear over and over from trans people who are lucky enough to make it to adulthood. And it's not indoctrination, it's not an industry. Our world isn't kind to trans people, especially trans kids. And if they were going to be indoctrinated into subscribing to any identity, it would probably be one with lower rates of bullying or abuse or self-harm. My wife has always known who she is. Kids know who they are if we let them show us. And she tried to show her family, but everyone in her life brushed it off as nothing because it was easier for everyone else to just not ask. She didn't receive care as a child. And imagine knowing who you are so innately, so clearly, and not having anyone in your life, the adults that you trust, the teachers that you trust, believe you when you tell them who you are. There's something that I want you to sit with. My wife's first suicide attempt was in 3rd grade. She was 8 years old the first time she tried to take her life. And she tried to take her life 2 more times before she reached adulthood and could finally transition. And I am so grateful and so lucky that she made it to adulthood, but a lot of kids are not that lucky. And she never tried to end her life because of who she was, but because of the world that she was living in and what the world told her that she was. The choice today is whether or not we get to say to our kids, our trans kids, our partners, our wives, our friends, our loved ones, thank God we live in Louisiana and you can get the care that you need and you get to be who you are and you get to adulthood, or do we have to just keep saying to our kids, thank God you survived. Thank God you threw up the pills. Thank God the gun didn't go off. Thank God you made it.
Thank you for your testimony. I want to thank everybody. We have some more to hear, but for anybody to sit at this table and do what you all are doing, either the proponents and the opponents, we appreciate it. We truly appreciate it. It's a tough vote that everybody's going to have to make, but I can tell you we appreciate all of you who take time to come here and talk. Thank you very much.
Thank you.
Thank you. Let's go to our next round of panelists. I think it's Abdul Khan, MD. If you're here, we'd like to hear your testimony. I'm sorry.
He wasn't here to speak.
Oh, okay. Thank you very much. Thank you. Logan Kinnamore, MD.
I waive my right to speak.
Thank you very much. Monica Detrack, MD. Monica is here. She's here. Okay, she's here to testify. Deepak Panching, is that? Sorry, I waive. You waive? Okay. Lindsay Hayslip? You waive? Okay. Let's keep going. Whitney Sawyer? Okay. Delilah Quinn? Okay, thank you. I apologize if I mispronounce anybody's name. Maxwell Cohen? Thank you. Jamie Segura? Okay. Logan Wolf? Okay. Rachel Knaps?
Some people might be in the overflow room.
Okay, I'll give them a little time. We called them out. If you're in the overflow room, Rachel Knaps, it's your turn. It's in C. We're in C. Tucker Barker.
They waived. They're in overflow.
Okay. Shiloah Marant. Marant. Okay, come on up. Peyton Middle.
Peyton Michelle, I waived.
Peyton Michelle, okay. We're going to work on your handwriting. Pearl Ricks. You wave. Sarah Jane Guidry.
I waive.
Okay. And Jennifer Hall. Jennifer. Oh, I'm sorry. She didn't want to speak. Okay. Did I call out Shayla Morant? I did. Okay. Okay.
My name is Shiloh Morant. I am a lifelong resident of Louisiana. I currently live in Baton Rouge. There were a couple of things I wanted to try to briefly go over. Somebody earlier a proponent of this bill mentioned that there is this invasion of public schools by transgender activists trying to recruit or indoctrinate. I've never seen any evidence of that, but it reminded me that a few months ago, there was a great discourse about furries and litter boxes in public schools, which turned out to be a complete lie. Another thing I wanted to mention is this idea of these puberty blockers and hormones being off-label. As far as I know, Viagra is still technically off-label for erectile dysfunction, and yet it's one of the most prescribed medications in America. Forgive me, my handwriting is erratic. On a more personal level, I wanted to mention a friend of mine that could not be here, unfortunately. He knew from age 7 that he was supposed to be a boy, and yet he was in a female body. When puberty finally hit him, it destroyed him. He made suicide attempts. He had eating disorders. He ended up in a psychiatric facility, all because he was experiencing a normal female period. Now, thankfully, he's gotten better. He is getting care. He is getting treatment. But this bill would create more situations like that. It would destroy more kids who do not understand what is going on and cannot deal with it. One of the other proponents mentioned the slippery slope. Where does gender-affirming care end? I'd like to take that in a different direction. Where does this bill end? If you approve this bill, if the legislature approves it, if Governor Edwards signs it into law, the first, pardon me, I have to read this directly. With the first link, the chain is forged. The first speech censured, the first thought forbidden, the first freedom denied, chains us all irrevocably. Those words were uttered as wisdom and warning. The first time anyone's freedom is trodden on, we are all damaged. That is what this bill threatens to do. Where will this end if you deny kids the care that they desperately need? Thank you.
Thank you for taking time to be here. Am I missing anyone on the proponent side that would like to speak, that checked a box off to speak? Am I missing anyone?
I don't think he's here. If you have any questions, I think.
No, the board is clear. So right now, now is your time. You can talk right now, Representative, and tell us your thoughts. And just as we did last time, all of these will be in the record. It'll be in the minutes of who has basically opposed this legislation. The floor is yours to close.
Thank you, Mr. Chairman, and I will go ahead and clear something up. Puberty blockers are not FDA approved for gender dysphoria. In fact, the FDA just added a warning label to puberty blockers for a condition called pseudotumor cerebri, which causes swelling of the brain, swelling of the optic nerve, blindness. But no, certainly not approved for use for gender dysphoria. Mr. Mixon attacked the credibility of one of my witnesses. I think it's very important for this committee to understand Mr. Mixon is a psychologist. Dr. Van Meter is a world-renowned pediatric endocrinologist. No medical doctors, to my knowledge, testified on their behalf. Mr. Mixon is also a radical activist who works for Ochsner's Hospital and is the governmental liaison for the Louisiana Psychological Association. Let me share a couple of tweets of Mr. Mixon's in regards to the Senator Mizell's Fairness in Women's Sports Bill. This is from July 14th of 2021.
You should
Chairman
close
Mills.
on the bill, sir. Come on now. Come on, we can start doing that.
Now, if the
On a
other
close
side can
should be on
attack the
bill.
credibility of my witness,
Make it then brief, really brief. You're
Okay.
real narrow. We're not going to sit here and read tweets.
hashtag binary is for computers, hashtag trans rights are human rights, hashtag trans Twitter, hashtag protect trans kids, hashtag trans is beautiful, hashtag gender equity, hashtag intersex. Thank you to Ochsner Health for allowing me to write this health blog. He goes on June 22nd, 21, attacking the legislature for passing the Fairness in Women's Sports Bill. So consider the testimony of a pediatric endocrinologist versus that of a psychologist. It is interesting that we've had no medical doctors testify on the opposition's behalf. And look, I think the rank and file members.
There's people, look, close your bill. Whoa, stop. This thing's getting out of hand. Close on the content of the
Okay.
bill and what the bill is going to do.
Okay.
I tell you, in my
Can I-
years here, I've never seen something like you. Come on, close the bill. Close the bill.
Can I address the report, LDH report?
That's the bill, yes. Please do.
Okay.
Please talk about the contents of the bill of the report. We're not going to insult people's characters.
Sir. Okay. All right. To the LDH report. The study resolution did not request that the report be confined to Medicaid data. The report was confined to Medicaid data. I will tell you this, the recent report just came out that indicates 61.1% of gender reassignment procedures were covered by private insurance, 15.8 self-pay, 16.5 public health insurance. There's a strong likelihood that the Medicaid billing codes are being manipulated. Here's a tweet from someone who says people like him are why I bill encounters with my trans clients as endocrine disorder, unspecified instead of gender dysphoria. A website of one of these medical groups performing these surgeries said they bill a lot of their gender dysphoric procedures as reconstructive procedures. Another one mentioned there are ways around Medicaid. The report cites studies and guidelines from activist political organizations like WPATH. Clearly, it's run by radical transgender activists, the WPATH. The report cites the study from the New England Journal of Medicine where 2 children committed suicide. That report is cited as proof of positive outcomes. If you want to go through the report, the report basically points to the fact that the studies it uses are worthless. So if you want to go to page 13 of the report, page 13 of the report, this is the LDH report in reference to their own data. Page 13, the included studies as such are unlikely to represent the transgender and gender diverse population of youth in the U.S. Page 14, Limitations across systematic reviews and individual studies include the small number of individuals enrolled in each study, variation in outcome assessment tools used, inconsistent follow-up durations, and selection bias. Long-term studies over 12 months are rare, especially physical or medical health studies. On that same page, they reference, as support of positive mental outcomes, the New England Journal of Medicine study where 2 kids committed suicide. Page 15, this is what they say of their studies. The authors also noted the limited number of small observational studies in this field. The authors highlighted that although hormonal treatment is associated with greater physical alignment of appearance, the effect on psychosocial or cognitive outcomes is uncertain. Same page, the authors highlighted the high risk of selection bias and small sample sizes. They again quote the New England Journal of Medicine article. Farther down in the page, they say, no statistical analysis was performed. Page 16, in regards to another study, the authors noted the findings are limited by small sample sizes, limited follow-up, and different measures across studies. They basically tear apart their own report in admitting that the studies used to generate the report have no scientific value. Chairman Mills, you have suggested that I can't discuss the credibility of people who are making statements or putting together reports.
I just want you to do a character assassination. If you want to talk about, most people when they close a bill, they talk about the contents of the bill. They talk about what the effect of the bill would be.
Well,
if you want to get into this type of thing, I've never seen it before. But
no,
why don't you talk about the closing of the bill?
The report was brought up, and I won't go into details, but it would appear that the report was prepared by a doctor who ran a gender clinic and by a left-wing activist group from Portland, Oregon. Okay, if you want further details, I'll be happy to discuss.
So could you close on the bill? We looking at the report. We've all seen the report. We've seen where. Just close on your bill.
Okay.
Please.
I'll be happy to answer any questions.
There are some questions. Yeah, okay. There are some questions. Senator Barrow?
I actually do not have a question.
Okay.
I just want to make a statement because I have been very quiet. I've listened very intensely. I have talked to several individuals, including my pastor, as well as different professionals before making a decision, because this is not a decision that I make lightly. Not that any of us make it lightly, but certainly as I have received an influx of calls, texts, emails like you too, Senator Boudreaux, from some people I didn't even know had my number. Don't know how they got my number, but they did, and they text me, and so I have not taken any of that information lightly, because any decisions regarding children, and everybody that knows me know that I give it the utmost consideration. And so I would just like to say that my decision would be based upon the information I received, the calls, and then something that my pastor said to me that gave me the truest sense of comfort. And one of the things that he said to me is that God does not violate our will. God allowed us, when he created us, to be free mortal beings. And he said that at the end of that, he said, I wish that all of us would be saved, but he allowed us to make decisions. And so for me, that is what is going to give me the most comfort in my decision making, and I just wanted to make sure I put that statement on the record. So thank you, Mr. Chairman.
As you always do, very eloquently said. Senator Luno?
Thank you, Mr. Chairman. So I'm going to state the obvious. This is hard. These are life-changing decisions that we make, and it is very, very difficult. When I first read this bill, when it was filed, there were some things in it that I thought were reasonable. I don't believe that anyone should have a sex change operation before they're 18 years old. I don't have problems with a lot of those issues. One of the things that we did is, like we all said, we've been bombarded with calls and visits and competing studies and everything else. And seeing competing studies in a medical setting is not unusual. What is unusual is when you see the vast majority of the national organizations dealing with medicine that all agree. And most of them agree that much of this therapy is good therapy and needed therapy. So that weighs heavily on my decision. We heard testimony from transgender people who were happy with their decision and some who were unhappy with their decision. And I believe them all. Because you know what? When we make a decision, and decisions in life, sometimes they're good decisions for us and sometimes they're not. We can't legislate that. That is something that people have to do on an individual basis, and we hope and pray that they make the right decision for them. One of the issues in this bill that gives me much concern is the fact that we would be taking away a parent's right to choose for the medical treatment of their child. I am a big believer in parental rights when it comes to those things, and I don't think we should do that lightly. I don't think that we should take away a parent's right to know what's best for their child. Now, does that mean that that parent decides to have a sex change for their child before they're 18? No. And we know this too, Representative Furman, but we haven't had that in Louisiana. It's a solution looking for a problem. Now, is it possible? Sure, lots of things are possible. Does it mean that it's likely to happen? It means just the opposite, because we would have seen, we would know, we would have the data showing us that this has occurred. I say all of that, Mr. Chairman, to get to my final conclusion that after a lot of soul searching, a lot of thought, a lot of listening, because I listen more today, like Senator Barrow, I listen more than I talk, and that's unusual for me because I got a big mouth. But I'm going to make a motion to defer this bill.
We have a motion from Senator Luno to defer House Bill 648, and before that vote takes place, once again, I want to thank this committee, each and every one of you. You have sat here for year in and day out to make tough votes and tough decisions, and whatever vote you all make, we all respect whatever you have to do. We do, and I want to tell you how much I respect you and how much I'm proud of you.
Chairman Mills, can I finish my close?
You closed.
No, no, sir, he asked me a question.
If you want to okay, go ahead. Go ahead.
Okay. Thank you for those thoughtful comments, Senator Luna. I will say, and you make a very good point. Here's a document signed by.
I tell you, from a parliamentary chair, we have a motion on the table. It's over. We have a motion on the table. We have to vote on the motion.
I don't get to close.
We have a motion on the table. You closed. This has been over a 2.5-hour hearing. We have a motion by Senator Luno to defer House Bill 648. Is there opposition to the motion? We have an objection to the motion. Madam Secretary, please call the roll. A yes vote is to defer. A no vote is to continue the bill forward. The objection was made by Senator Mizell. A yes vote is to defer. A no vote is to keep it going. This is her first time for a vote, so please give this her first time.
Okay. Senator Barrow?
Senator Barrow?
Yes. Yay. Senator Boudreaux?
Yes.
Yay. Senator Carter?
Yes.
Yay. Senator Hinchton? Nay. Senator Lunow? Yay. Senator McMath? Nay. Senator Mizell? Nay. Senator Pope? Nay.
It comes down to me.
And
I'm going to make a statement too then. I guess I've always, in my heart of hearts, have believed that a decision should be made by a patient and a physician. I believe in the physicians in Louisiana. I believe people that are licensed by the Board of Medical Examiners are well regulated. I believe in the scope of practice. I believe in the standard of care. I have to tell you, before I made this vote, I was wide open to hear it. But when I see page 8 that says from 2017, 2018, 2019, 2020, 2021, there were 0 procedures surgically. 0 procedures surgically. What I've heard from the testimony of the proponents is some horrible stories, and it shouldn't be like that. But that's the Board of Medical Examiners' job to go after a malpractice suit. That's the Board of Medical Examiners' job, is to revocate those licenses of physicians. So for that, because I do believe in a physician, and I believe in the right for a family to choose what's best for them, I vote yes.
Senator Mills, yay.
Yeah, now you add motion. Now you'll be ready to move on to the next. Okay.
Let's read the vote, please. Celeste, I'm sorry.
5 yeas, 4 nays. 5 yeas, 4 nays.
The bill has failed. HB 648 will be deferred. So let's get through the rest of the agenda, ladies and gentlemen, and we'll go from there. Senator Mizell, can you wait? Since you're on committee, are you okay with waiting and getting the rest of the agenda out? Yeah, I'm thinking with the committee members. Is Representative DeVilliers here? Ladies and gentlemen, we'll be hearing House Bill 181 by Representative DeVilliers. I think they worked it out. Representative DeVilliers, I was getting a bunch of calls from coroners on this bill and different folks, and I want to tell you, you've worked closely with our staff, and I think you've come up with something that makes sense, and I'd like to maybe tell us a little bit about why you bring this bill to us, what would be the impact, and what your amendment does, and staff's ready to help you with this. Why don't we let the room clear out for a couple of minutes, and then we'll get started. So, ladies and gentlemen, we right now, once again, on House Bill 181, and you do have a set of amendments that I think will put this bill in its right posture. So, Representative DeVilliers, we'll turn it over to you, and then we'll go from there. Thank you very much for being here.
Thank you, Mr. Chairman and members. House Bill 181 is actually a simple bill. We've tailored it down to just allow coroners and deputy coroners the ability on the 72-hour certificate to do telehealth medicine, provided that the first certificate wasn't done via telehealth medicine. I've worked with a lot of stakeholders with this bill. We've had to change it a little bit through the process because, quite honestly, I didn't really and truthfully know a whole lot about the subject matter. But working along with your staff, and I know you'll have an amendment to offer up, I think we have it in the best posture moving forward. So I'll try to answer any questions that you may have.
Why don't we do this, y'all? Why don't we get the amendment in its right posture, and then why don't we talk about really what's the change? You know, what would be the change? So Ms. Cannon or Ms. Peck, if either one of y'all would want to go, or Mr. DeVilliers, if you wanted to go through the amendment, or you rather staff?
Yeah, it would be great.
Okay, so Ms. Cannon, once again, 2155, why don't we go over it? Let me get you on. Okay.
Thank you, Mr. Chairman, members of the committee. The first two amendments are technical. For the third amendment, which has the substantive part, Christine and I met with Representative DeVilliers, because reading his bill, we weren't quite sure what the intent was. It had a lot of amendments, so we wanted to clarify exactly what the goal of his bill was, and to see if we could do maybe some clarifying amendments. And so after meeting with Representative DeVilliers and speaking with him, this is what we've drafted. So basically, the only real substantive change is that if a coroner is a physician or his deputy coroner is a physician, they may use telehealth to conduct the 72-hour independent exam. And it keeps in the law the exception that if the preliminary exam, when the person was admitted for the PEC or the CEC, was done by telehealth, then the second 72-hour exam has to be done in person. And then this amendment number 4 is really just technical to clean up outdated language.
Very good. I will offer up that amendment. Is there any opposition to Amendment 2155? Seeing no opposition, it is adopted into the bill, and the board is clear right now. Senator Barrow?
So I'm assuming, Mr. Chairman, with this adoption of the amendments, because I did receive a lot of calls from psychiatrists, et cetera, about this bill, that this clarifies that and clears it up?
That is my understanding, Senator Barrow, and I'm more than willing to continue to work through the process, but
okay.
I'm trying to have it in the cleanest form to where it definitely expresses the intent of what we're trying to do.
Okay, awesome. All right, thank you, Mr. Chairman.
Thank you very much. Did y'all want to testify or just have clarity or anything else? I guess at the end of the day,
Unless
so everybody.
you have any questions.
I guess at the end of the day, so everybody understands, with the amendment adopted, what would be the change logistically?
So I'm the coroner in St. Landry Parish. We have a big parish. It's a rural parish. If someone comes in under an emergency certificate, a PEC, the coroner has 72 hours to come and do the coroner's emergency certificate. So if you have issues where they notify you late or you're short-staffed or that, there's a risk that can expire. So this will allow physician coroners and physician deputy coroners to do that by telehealth. So it's,
They have to be physicians, right?
correct.
Okay.
So it says specifically that, and that's the only change is that we'll be able to do that by telehealth. I know the psychiatrist that testified in the House committee had no problems with the telehealth. They had some issues with the language, and they wanted to make sure that a physician was doing that. This does that, and it's just coroners who are physicians and deputy coroners who are physicians will be able to do those exams by telehealth.
Very good. Yes, sir. Did you want to add to the testimony?
Senator, the only thing I would like to do is compliment your staff on the wording of the bill. In doing 3 sections, A, B, and C, under number 2, the staff was able to clarify what we were trying to do in a month. So I really appreciate that. I think the bill speaks for itself. It doesn't change anything other than allowing rural coroners to get to do that second exam that is so important in a mental health crisis situation. That's what this law deals with.
Well, I want to thank Representative Villa because he saw there was some opposition. He wanted to address it. He wanted to correct it. He met with Ms. Cannon, and he basically said, this is what I want to do. This is not what I want to do. So I want to congratulate you. And I will see that I did see, I want to make sure I'm seeing this right because I saw some cards of opposition. It's turned to green. Is that correct? Okay. So that's really that's commendable for all of y'all. I really appreciate that. So I did see the only person I did see, and you, Jamie, you did say you have a green card now. Dr. Preston, did Dr. Preston want to testify in opposition?
I did this morning.
Oh, I'm sorry. I'm so sorry. I do have a question by Senator McMath. And no, I'm sorry. The board's lit up. I'm sorry. Senator Boudreaux, did you have a? I see your board's lit up on that.
Yeah, did somebody want to speak?
Yeah, Dr. Preston in opposition. Okay, so we will take that. Yeah. So let's. Okay, we do have a question. I'm so sorry, y'all. Stay at the table, and Senator Luno, you were next. Did you have a question?
I do.
Okay, Senator Luno's got a question.
Couple
and then
things.
We'll get you, Senator McMath.
Currently, who can do PCEs and CECs? Does it have to be a physician?
The law says it's the coroner or his deputy, and that's what we've left intact. So.
You're asking about PECs specifically?
RCEs, either.
Well, see, when we use PEC and CEC, we tend to jump forward. Why don't we use first exam and second exam? Because either a CEC can be the first exam or a PEC can be the first exam, and then we swap over again. So first exams can be done by anyone listed in 2853B1.
Which is who?
Which is physicians, physician assistants under a collaborative agreement, and psychiatric mental health nurse practitioners, and psychologists.
So how often do patients see psychologists before they have a PEC hearing?
It depends on who's in the emergency room when the person goes in for crisis, Senator, to tell you the honest truth. The fact is that when mental health crises occur, they don't always occur on a schedule that is predictable. So at 3 in the morning, this stuff usually happens, is when it usually goes viral or whatever you want to call it.
Under the amendment on the telehealth portion of it, I'm assuming that the examination would be the same as if you were in person. It's just by video means, so we can help in rural areas and things of that nature.
Correct.
Okay, thank you.
Thank you, Senator Luno. Senator McMath?
I was actually going to ask very similar questions, so I got my answer. You beat me to the punch.
Thank you. Looks like the board's clear as far as the proponents. We do have one person in opposition. Dr. Charles Preston would like to speak from the St. Tammany Coroner's Office.
We are at good afternoon now. Thank you so much.
Yes.
I am Dr. Charles Preston, the St. Tammany Parish Coroner. I have to say that for the last 5 days that I've been involved in this bill, I have been very, very, very concerned about how that is going to affect St. Tammany Parish. We are the only coroner's office in the state right now that I'm aware of that are actively using telemedicine and have been using telemedicine for approximately the last 3 years. The carve out for St. Tammany Parish predated me, but it became very, very useful during the pandemic so that my doctors were not going from place to place to place carrying COVID with them.
Right.
The bill seems to have come around, and my very basic concern
Get a
is
copy of the amendment?
I got the
Okay, good. I want to make sure you see
last
it.
amendment this
Okay.
morning.
Okay, good.
And I think that now my red card is green or my green card is red. But I just want to be on the record to say I do not want anything to change in the language as it applies to St. Tammany
Your
Parish.
parish, yes.
And the language that says CEC should be done by a physician who is a deputy coroner needs to stay intact. And in our language, it says a physician, preferably a psychiatrist.
Right.
I am fortunate enough to have 2 full-time psychiatrists who do these instruments for the coroner's office. And very frequently, that's the first psychiatrist that ever sees the patient, is the psychiatrist from my office in that 72-hour period. So my position has really been from the beginning, the rest of the state can change anyway, but I think that we have a system, it's working, it's been working for me, it's in place now, and I just want to make sure that nothing in paragraph 7 that applies to St. Tammany Parish should be changed at all.
We're fine with that, and I will tell you from the author talking to our Senate attorneys, he doesn't want to do any of that. He really does not. So if you see anything that gives you discomfort between here and the Senate floor, Representative DeVille will work with you.
Excellent, thank you so much.
Thank you, and thank you for your service. Senator Boudreaux?
Let me show you how you close. Phil's one of our St. Landry Parish reps. Thank you for working with everybody on this bill. Our coroner from St. Landry. Thank you all for being here. With no opposition, Mr. Chair, I'll move favorable on HB 181. And again, thank the author and our staff for going above and beyond to make sure this is a smooth transition. The best closing you've had.
Thank you so much. And I just want to, I do want to mention Chairman Mills and your staff. Y'all got this in order very, very quickly. I appreciate that greatly. But there's one individual that worked harder than I did with this bill, and it's Rep. Miller. He gets all the thanks. So without him, I wouldn't have been able to get this far.
Don't praise this man too much, please, please.
Thank y'all.
No, and Senator Matthew, you had a statement prior to the vote.
I did. I just wanted to make sure that we were on the same page with Dr. Press and myself and Senator Mizell are constantly battling St. Tammany being considered very high maintenance. And I want to thank you for helping further that dialogue, Dr. Preston. So we really appreciate it. And but if you're good with it, I'm good with it. All right.
You know, before we take the vote, I got to tell you, Miss Peck and Miss Cannon can turn potted meat into a ribeye. They're unbelievable. I mean, they're good. They're good. All right, so we have a motion by Senator Boudreaux to report HB 181 as amended. Is there any opposition? Seeing no opposition, it will be reported as amended. Thank you very much.
Thank you, Mr. Chairman.
And we have only cards now of support, and Dr. Preston turned into a very light green. And let's see, I'm not sure who's been here first or who's ready to go. Who wants to go next? Yes, ma'am. Okay, what we'll do is I forgot a senator, but ladies first. So, Senator, we'll get you next.
Oh, I'm so sorry.
Always, yes. Yes.
Okay.
So, ladies and gentlemen, we'll be talking about HB 587 by Representative Moore. Welcome, Representative Moore, to the committee. We appreciate you being here.
Okay. Good afternoon, Mr. Chairman and committee members. Thank you for giving us this few minutes to present to you HB 587. I just want to quickly remind you all that in 2019, you all passed SCR 70 by Senator Regina Barrow to create the Louisiana Community Health Workers Workforce Study Committee. I want to thank you. I was part of one of the members on that committee. She asked that we submit a study and provide recommendations to the Secretary of the Louisiana Department of Health relative to supporting and expanding the community health workers in Louisiana. That report was submitted on May the 20th. And because of the results of the study, this is why we're here, HB 587. And I will yield to.
Good morning, or good afternoon. It's been a long hearing so far. Thanks for the opportunity to be here, Chairman Mills and committee. My name is Ashley Wennerstrom. I am an associate professor at LSU Health in New Orleans. I just wanted to provide a little bit more background and context based on what Representative Moore has shared already. She mentioned the Community Health Worker Workforce Study Committee. I had the honor of co-leading that through my position at LSU, along with Catherine Haywood, who's the executive director of the Louisiana Community Health Outreach Network, which is the Community Health Worker Professional Association for our state. We're very honored to have that opportunity and really wanted to work closely with the Department of Health to provide recommendations about how to expand this workforce in our state. Community health workers are a unique workforce in that they are non-clinical members of healthcare teams. They do a lot of work like outreach, health education, really focusing on prevention and helping people navigate complex healthcare systems. And they are an incredibly effective healthcare workforce as well. There's plenty of evidence, which I will not bore you to tears with today, but they do improve outcomes for a host of chronic diseases as well as save money, particularly in Medicaid settings. So the purpose of this bill that Representative Moore has introduced is to create a board that will provide recommendations about standards for training community health workers, just with the goal of ensuring that they are up to par and doing the best job that they can in our state.
Very good. Senator Barrow, for a question.
Thank you, Mr. Chairman. And so, first of all, let me just thank you, Representative Moore, for following up on that study resolution. And as a result of that, that was some of the probably which you guys recognize that needed to be added or done in terms of bringing level of continuity, level of care, et cetera, I would assume.
Yes.
And so I greatly appreciate that. I know that there was an amendment you wanted me to add, but we got so engaged in the last bill that we didn't get a chance to do that. So I want to let the committee know that I will like to offer that amendment between here and the floor. But at the appropriate time, Mr. Chair, I'd like to ask that we report it favorably.
Thank you very much. So noted. Senator Mizell?
Thank you, Mr. Chairman. I as well, I like this, but I may piggyback your amendment because I would really love to see someone from the community college system participate in this because in rural areas especially, if we could engage community college people with high school students to get certifications to be health workers, I don't know if that's the direction you're going, but I'd like to talk to you about it.
Okay, appreciate it. And please get with Ashley. She's very, very familiar with everything.
Happy to chat with you. Yeah, we'll have a conversation.
Okay.
Okay. Thank you.
Good.
Thank you, Mr. Chairman.
Ladies and gentlemen, the board is clear. Let me just read it because we do have a court in opposition that would not like to speak. But Dr. Winsher, you just gave your testimony as a white card for informational purpose only. Catherine Haygood is in support. Ann Jays is in support. Ellen Palmentier is in support. Stacy Roussel is in support. Reagan Carter is in support. In opposition, but does not wish to speak, Marianne Marchett. Marianne is in opposition. So we do have a motion by Vice Chair Barrow to report HB 587 favorable. Is there any opposition? Seeing no opposition, 587 will be reported favorable. Thank you very much.
Thank you all.
Senator Barrow, did you want to say something?
I do. I would like to acknowledge one of our colleagues who's here, former State Senator Wesley Bishop. How you doing? Good to see ya.
Yes, so good to see you.
Did you miss all the excitement earlier? Okay.
It's
Thank
good
you.
to see you again, Senator. Senator Duplessis, you're so patient, and I should have taken you first since you were sitting senator. But tell us a little bit about your resolution and what it accomplishes.
Yes, good afternoon, Chairman, good afternoon, Committee. What we're aiming to do with Senate Resolution 98 is to encourage the state of Louisiana to look at the feasibility of applying for a waiver to obtain Medicaid for incarcerated individuals. As you all probably are very well aware, Medicaid, up until this point, has never applied to individuals who are incarcerated, including juveniles. But as of recent, 15 other states in the United States have begun pursuing this, with California being the first to be granted an 1115 waiver that would apply to a very limited population of returning citizens within 90 days of their release to deal with behavioral health issues, drug addiction, and those sorts of issues, so that we have some sort of continuum of care when these individuals are released. And we know the benefits of that, the savings that it will have for us as a state, and how we've benefited just from expanding Medicaid since 2016. This is an urgent request to the Department of Health to look at the feasibility and the cost of applying for such a waiver. And to get it in the proper posture, I do have some language and amendment, Mr. Chairman, that would just provide clarifying language in the title and in a few other lines throughout the resolution that simply says,
right,
study the feasibility, and not as direct as apply for one.
Vice Chair Barrow offers up set 2088. Is there any opposition to 2088? Seeing no opposition, that set of amendments has been adopted. And report is amended. Senator Boudreaux, the floor is yours.
No,
Oh, you got it?
no,
Okay.
she just did it.
Okay. The board is clear. We have only cards of support. We have a motion to report SR 98 as amended. Is there any opposition to the motion? Seeing no opposition, it will be reported as amended.
Thank you. Thank you so much.
Thank you very much. Senator Mizell, do you want to do yours from here? Oh, we could. Why don't you do yours from here?
You want to get rid of Miller?
Yeah, Representative Miller, we'll take you next, and then we'll take Owens next. So, I'm sorry, let me give you the floor. All yours.
Okay, thank you. Thank you, Mr. Chairman. What I have is Senate Resolution number 96. There is an amendment, if I could offer up the amendment. The intent of the original resolution was to look at the long-term effects of medical marijuana, and looking at that because we've had a constant expansion of medical marijuana in our state, and we hear from constituents of concerns they had. I got it. But the amendment would also include hemp containing THC and kratom in that resolution, to look at the long-term effects of that, and where we are as a state with the distribution of that. That's what the resolution does, and I would offer that up.
Sure. We have a resolution 1955, I'm so sorry. We have amendment 1955, which is offered up by Pro Tem Mizell, and she's basically adding two different studies to it with kratom and also hemp with THC. Mm-hmm. Is there any opposition to her amendment? Seeing no opposition, that amendment is adopted. The board is clear. We have a motion by Senator Mizell to report SR 96 as amended. Any opposition? Oh, somebody did want to speak. You waive? Okay, very much. Do you have any opposition to report SR 96 as amended? Seeing no opposition, it will be reported as amended.
That way.
Representative Miller, you next.
Okay. Who was that opposed?
Good morning, members. Mr. Chairman.
We don't wake up here at 11 o'clock like y'all.
I've been in the back waiting for y'all all day. Listen,
I feel like it's just waiting for me.
All right, tell us a little bit about what the bill does and why we need it.
All right, Mr. Chairman, this bill is just amending existing law. What happens now is school employees have like 10 days a year that they can have for sick days. Give or take if they roll some over the year before. But the way the law reads now, anything over 10 days, they must have medical excuses from a physician. Well, some of the employees don't see physicians, they see mid-levels, or they might be at an urgent care and they go see a PA, a nurse practitioner, et cetera. Could be something simple like a cough, or, not a cough, like a cold, or when COVID came, et cetera, where you were off for so much time. Well, when they would go back to work and say, hey, I was off, this is a diagnosis, this is my excuse, the school boards couldn't accept it because it wasn't a physician. Well, then they didn't have one to go to. So this just amends it. It isn't any long-term disabilities or anything. This is just short-term illnesses, allowing whoever is their provider to fill out the paperwork.
Well, I tell you what, you have only cards to support it, and let's see what Senator Luno's got to say.
I think this is a cost-saving measure because these folks can go to a PA instead of a doctor that is typically less costly, and it helps with insurance and employers and everybody. It's a good bill, move favorable.
Thank you. And it's just whoever they saw. They fill out the paperwork, whoever diagnosed them, and they can turn it in. If it gets to where
we have a motion by Senator Luno to report House Bill 652 favorable.
Thank you.
Do we see any opposition? Seeing no oppositions, HB 652 will be reported favorable. All right. I think we got one last bill on the agenda. Representative Owen. Yes, sir. Senator Luno?
Can I make a request before we start this last bill? I'm willing to move favorable if Representative Owens will adopt the Bob Odom campaign song as his official campaign song. Maybe we're to get him to sing it for us, too.
Bob Owen.
It's good we laugh a little bit. We had to laugh a little bit. It was a tense debate. So we have House Bill 460. Tell us what it does and why do we need it. And we do have a set of amendments that we are passing out. So why don't we talk a little bit about the bill, then we'll talk about the amendments.
Thank you, Mr. Chairman, members. House Bill 460 actually should be honestly labeled as a specialty pharmacy bill. It's really a cleanup bill. It makes simple adjustments to the way patient count is adjusted for issuing satellite pharmacy permits. And basically it prioritizes access for rural patients. It plays off of Representative McGee's HB 697, which we passed last year, and it's having a major impact on the program. This does not expand the program at all. It's basically just streamlining the program. If we want to adopt the amendments now, we can do that.
Yeah, why don't we talk about because it does change the bill from an aspect there. So we have set 1714. Would you like for Ms. Cannon to review them, or would you like to?
Sure.
She'll vote. Who or her? Okay. Ms. Cannon?
Thank you, Mr. Chairman, members of the committee. So amendment number 1 is technical, amendment number 2 is technical, and amendment number 3 is technical. Amendment number 4 is just to clarify, the bill currently says that the applicant has to, the license holder, when he is eligible to open a satellite location, will be notified by the Board of Pharmacy and then has 90 days after getting that notification to apply to open the satellite location. This is just language to clarify that, because right now that notification doesn't exist in the law. And so if you become eligible before this bill becomes effective, when does that kick in? So this is just to clarify that 90-day period that's in this bill only arises when you get a notification from the Board of Pharmacy of your eligibility. Amendment number 5 will grant, so when the applicant has the 90 days, then they have 310 days for the satellite location to become operational. This language will allow the Board of Pharmacy to grant additional time if there's a circumstance beyond the control of the licensee. And then amendment number 6 is technical, and amendment number 7 is to remove language that referenced notifying in the case of a transfer of ownership.
Very good. I'll offer up those amendments. Is there any opposition to this set of amendments? Seeing no opposition, those amendments have been adopted into 460. Any questions by the committee? We have only cards of support. We do have one question by Senator Boudreaux.
No, sir. At the appropriate time, I'll move favorable as amended.
We have a motion to move HB 460 as amended. Is there an opposition?
Mr. Chairman?
Senator Pope? I'm sorry.
Can I make one statement, please?
Of course.
I just
Let
want to
me
say.
give Senator Pope the floor.
Yes, sir.
Senator Pope?
There has been a motion, and I'm not going to object to the motion, but I want it understood that when it gets to the floor, there may be a no vote because that's been my consistent thing. But I am not going to object to this today.
Thank you, Senator
Mr.
Pope.
Chairman, I want to say on the record that we have been working on this issue since 2013. You have been with us every step of the way. Because of your help and your leadership, we have created in this state the most medical of any medical program with ag departments, the Department of Health, and the Board of Pharmacy. We have over 60,000 patients now in this state who will tell you this has changed their life. It has helped them get off of different drugs. It has helped them improve everything they have. And I just want to say on the record from everybody in this industry, we could not have done it without you, Senator Mills. And I'm going to miss working with you, and we are proud and just thankful for everything you've done in this field. Thank you.
Thank you. And you know, we can always have problems in any program, but you know, for me, it brings tears to my eyes. But when I can see somebody has a debilitating disease and it helped them, and that was their last choice and last chance, it makes it worthwhile. Thank you very much. We have a motion by Senator Boudreau to report HB 460 as amended. Is there any opposition to the motion? Seeing no opposition, HB 460 will be reported as amended.
Thank you, Mr. Chairman, members.
Thank you all. So I guess committee members, I guess we got probably one last dance as far as a committee next Wednesday. We have some bills coming in. And y'all, I think it's not our last dance. You know, we'll have something between here and January that we'll have. So let's see. So I want to just thank you all. I know today was a day that we signed up for, but I want to thank you because it was, I think we gave the public a fair debate. Thank y'all so much. It's a pleasure to be with y'all. And Ms. Peck, Ms. Cannon, Kelsey, all of y'all, thank y'all so much. Poor Kelsey, this was her first go-around. So motion to adjourn by Senator Pope. Any opposition? Thank you very much. Thank y'all.
Look,
Always entertaining. Always entertaining.
They holding the food in the cafeteria for us. They did? Yeah, they holding it, so let's go.
Y'all go get a bite. I got something.